morning. So grateful for everyone to be here, celebrating the San Luis Valley Holistic Health and Wellness Fair. It's our first annual. We're so grateful for everyone's participation, coming here today, celebrating health and wellness and all the things. So my name's Alicia Chambers, and looking forward to an amazing day with some fantastic, inspiring speakers. Focus on your breath. And if we can hold an intention for this day, may we all find our own health and wellness in our homeostasis in every moment. And may anything that's holding us back from our healing, please
So I'd like to begin with a little soft belly breathing. If you could all just sit in a chair, put your feet flat on the floor, hands in your lap, and just begin to notice how it feels with your seat on the seat, your back up against the chair, and to begin breathing. Just very, very slowly in through the nose and out through the mouth. And as you inhale, allowing your belly to be soft, to rise ever so gently. And as you exhale, allowing your belly to fall, collapse against your spine. As you inhale, the diaphragm will flatten. It'll push the organs down. Your belly will rise ever so slightly. And as you exhale, the diaphragm comes back into its U shape. The belly begins to fall against the spine. This very slow, steady, rhythmic breathing is one of the fastest ways to calm the central nervous system. We call it, in science, diaphragmatic breathing. In mind-body medicine, we call it soft belly. Allowing the belly to rise, to be soft, to fall gently against the spine, and just breathing slowly in through the nose and out through the mouth. As you breathe this way, the vagus nerve, which is the only cranial nerve that leaves the brain, gets stimulated and also relaxes all of the organs in your body. It innervates every organ system. So as you breathe this way, in through the nose and out through the mouth, you are actually asking your body to relax. So softly, in through the nose, out through the mouth. If you're comfortable, close your eyes and see how that feels for you. Notice your breath. And notice that as you breathe this way, you may have thoughts that come in. But you don't have to focus on them, you can let them go. Focus on the breath, breathing in through the nose, breathing out through the mouth. And allow the thoughts to come and then to go. And continue breathing slowly, slowly. Just noticing. Maybe you can hear the fan in the background. The children. Maybe you can feel your body and the sensations. Just notice. And focus on the breath. And just keep breathing in through the nose, and out through the mouth. And with another breath, in through the nose, and out through the mouth. Wiggle your fingers, wiggle your toes, move yourself back into the space. Maybe putting a smile on your face as you open your eyes. My questions for you today: who are you? Why were you born? For whom will you die? Today we're talking about resilience. Resilience is the ability to bounce back from adversity, to overcome challenges, to adapt to change, while maintaining emotional resilience, emotional regulation. It's a crucial skill that can help you navigate the ups and downs of life with grace and strength. There are 5 key components to resilience: emotional regulation, positive thinking, problem-solving skills, mindfulness, and social support. Emotional regulation refers to the ability to monitor, to evaluate, and modify your emotions in order for you to maintain an appropriate emotional state. It also includes being able to identify and recognize your emotions, to understand the causes of your emotions, and to identify the triggers for your emotions, to be able to reduce them or amplify them as needed for any given situation. Being able to express your emotions appropriately, to be able to communicate your emotions in a healthy manner, to develop strategies to deal with your negative emotions. That is emotional regulation. That's a tall order. Positive thinking is the practice of focusing on what's good in any given situation. Approaching life expecting things to go well, rather than dwelling on the negativity. Problem-solving skills, the ability to identify a problem, to analyze the situation, to brainstorm some solutions, and then to implement the best course of action to resolve the issue effectively. Mindfulness is the moment-to-moment awareness, calmly noticing thoughts, your emotions, accepting those thoughts and feelings, bodily sensations, your environment, without judgment. Just noticing it, not judging it. Social support is love and connection. Can you receive? Can you give? engaging in activity and social events with others. These are skills that we develop. We are not born with them. Your attitude matters. The willingness to learn is important. Coming to any situation with an empty cup. If you've struggled with adversity in your life, you might have an amazing skill set. Or maybe you're trapped in a stress response, in some response cycle that you just can't get out of. It's very common in our society, and we call it trauma. For the existence of humankind, we have met adversity. We came here naked, no place to live, and no food to eat. And we've had to figure out, we've had to adapt. We've had to figure out how to have shelter, how to get clothing, how to be hunted, or be the hunter. We've had to make things work for ourselves. We've decided we wanted something, we figured out how to make it happen, and then we made it better. We created shelter, and then we decided we wanted heat, and then we decided we wanted running water, and we wanted electricity. We figured all these things out. We're still doing it. Every single day, we're coming and we're adapting and we're creating for ourselves. All of that took social support, problem-solving skills, mindfulness, emotional regulation, and positive thinking, for sure. We have, as humans, have essentially conquered the first two levels of Maslow's hierarchy of needs, the physiologic and the safety, for the most part. Now, as a global society, we are really working on being emotional, recognizing ourselves as emotional beings. We're working on the last three parts of Maslow's hierarchy: the social support, love and belonging, esteem, self-respect, and respect for others. And finally, self-actualization, reaching one's full potential. We are realizing that we are emotional beings, and we are realizing that this requires emotional intelligence, emotional regulation. My favorite Zen proverb: you are perfect, just the way you are, but there's always room for improvement. The keys to resilience, emotional regulation. Can you identify, can you notice and recognize, identify, and communicate effectively your emotions? Positive thinking. Can you see the good in any situation? Problem-solving skills. Can you identify a problem and then find a way to make it better? Mindfulness. Can you be aware moment to moment without judgment in your environment? And social support, love, and connection. Overcoming adversity or trauma means learning skills that help you move through those emotions. The untapped, unresolved emotions held very tightly within you, under lock and key, where no one can see the real you. If you are willing to learn some skills to help you unlock those untapped, unresolved emotions, you will expand your consciousness. You will learn emotional regulation. You'll become unstuck. You will see your way to more positive thinking. You will develop problem-solving skills or improve them. And your mindfulness will develop. You will also want, even crave, that social support. You begin to realize that you are an amazing being. All of your life can be a struggle, or it could be a classroom. I prefer mine to be a classroom. And this is not to minimize hard trauma, but it is to let you know that you have a choice. Life can happen to you, or life can happen for you. You are not your thoughts. They can definitely create some very disturbing influences, but you are not your thoughts. You are not your emotions. You get to experience your emotions, but you are not your emotions. When you learn to notice your thoughts, you can choose the ones you want to keep, and you can discard the ones that don't serve you. What do you want to focus on? What do you want to think about? How life happened to you, or how life is happening for you? You can focus on what's going well, you can focus on your dreams, or you can focus on what's going wrong. It's your choice. You get to choose. When you notice your feelings, you can choose those too. Thoughts drive feelings, so be selective with your thoughts. Feelings drive your actions, so be selective with your feelings. And your actions drive your results. So if you want to change your results, you gotta start with your thoughts. Your mind, by the way, will do whatever you tell it to do. It wants a job, and if you don't give it one, it will take random thoughts and run amok. But if you give it a job, and if you just say, hey, mind, today, we're going to focus on all the things that are going well for us. And I want you to remind me around 3 o'clock what that is. And you know what? That's exactly what will happen. At some point in your day, your mind will stop, and you'll start noticing all the things that have been going well for you today. And when you're going to bed at night, tell your mind, okay, your job tonight while we go to bed is, I want you to help me recognize all the things that I appreciate in my life and start listing them. You'll fall asleep, but when you wake up, you'll still be listing them. And that's a great way to start the day. You have a choice. When you know your thoughts and your emotions, you have mastered 2 very essential skills for resilience. Emotional regulation, that's a big one. You are in charge of the thoughts. You get to choose them. But first, you have to notice them. We call that mindfulness, another essential skill. You're in charge of your emotions, but you know what? You've got to notice those too. And when you're willing to notice them, and when you're willing to stop and feel them, then when they show up in times of chaos, you're not so afraid of them. It's helpful if you will learn to feel your emotions. The good ones, the bad ones, experience them, know what they're like, so you're not so afraid of them. You need to accept them, experience them, let them go. You can't have love if you haven't ever felt deep sadness, despair, and grief. You can't have bliss and joy if you don't allow yourself to feel the really negative, deep, dark emotions. Eckhart Tolle says, the world is not here to make you happy. It's here to make you conscious. Abraham calls it contrast. For me, I'd like to rephrase it and say, you're here to expand your consciousness. And contrast illuminates it. There are growth opportunities all day long, every day. Anytime you're challenged, it's an opportunity for growth. How you respond or react is a choice, and it will determine the outcome. So resilience is the ability to bounce back from adversity, to overcome challenges, to adapt to change while maintaining emotional regulation. It's a crucial skill that will help you navigate all the ups and downs of life with grace and strength. Those key components to resilience are emotional regulation, positive thinking, problem-solving skills, mindfulness, and social support. So now I'd like to take you through some thoughts and feelings. So if you'll have a seat, just enjoy, sit back, relax, put your feet on the floor, put your hands in your lap again. And if you're comfortable, I'd like you to close your eyes, and I would like you to think about something that just makes you really anxious, super anxious, anxious. Just think about something that makes you anxious. And as you get a hold of that thought and you lock onto it, I want you to notice your body. What's happening in your body? Where is that anxiety in your body? What part of your body? How does it behave? Is it jumping? Is it spastic? Is it throbbing? Is it aching? Is it pulsing? Is it moving? What is it doing? Is it big? Is it small? Is it dark? Is it light? Does it have a color? What is it doing? Where is it going? And as uncomfortable as it may be, embrace that anxiety and feel it. And as you feel it, and as you embrace it, what's happening to it? Is it changing? Is it getting stronger? Is it getting less intense? What's going on? And now, take a nice big deep breath in through the nose, out through the mouth, and let it go. Open your eyes, and I want you to stand up, and I want you to just shake it out. Let it go. Just let all that anxiety go. Just shake it out. So, big deep breath in through the nose, out through the mouth. Now, I'm going to have you sit back down. Close your eyes one more time. This time I want you to think about something that brings you excitement, joy, just going on this really cool trip. What's happening? What's bringing you really intense excitement, joy? I want you to focus on that. Where in your body do you experience that joy, that excitement? What does it feel like? Does it pulse? Does it throb? Does it run? Is it electric? What is it like? What is the color? Is it big? Is it small? And as you focus on it, and as you embrace it, and as you accept it, what happens to that excitement? What's going on in your body? And feel it. And does it change? Does it get more intense, less intense? What's going on? Taking a nice big breath in through the nose and out through the mouth. And begin to let that excitement go. And as you open your eyes, who would like to tell me what that was like? Excitement versus anxiety. Yes. So, exactly. What's really neat about anxiety and excitement? She felt them in the same place, and they felt almost the exact same. And what's really important about that is that when you're anxious, if you can change the thought, it becomes excitement. It's the same sensation. Did anybody else have the same or similar experience? Or a very different experience they'd like to share?
It was similar for me, Katie said, definitely really energetic feeling of it because the request to go out with discomfort was noticed and taken. And then the excitement part, something felt good was noted, but it's true, the emotional part was kind of similar, and it was similar.
Nice. Thank you. Thank you for sharing. So what's important here is noticing, being able to feel your feelings, to feel those emotions, but to be able to become comfortable with them. We don't like fear. We don't like anxiety. We don't like anger. We don't like despair. But if you can feel that and recognize it in your body, where it is, and what it's like, it's not nearly as threatening. And if you can connect the thoughts that are going on with the emotion, very, very powerful. Because that gives you the power to be able to change the emotion by changing the thought. These are two very essential skills for resilience. And if I taught you nothing else today, I hope I taught you that. So the mindfulness, the breathing, feeling, knowing your thoughts, being able to identify them, being in touch with them, being able to feel the emotions that you're experiencing. Very, very essential skills. And again, I'll ask you, who are you? Why were you born? And for whom will you die? Thank you.
Oh, thank you so much, Bronwyn. Really round of applause for the wisdom that comes with resilience, being in touch with our own mindfulness. It's a big theme I'm sure we'll hear more about as we go through the day. And our next speaker will be at 1 o'clock, and that will be Cherie Bedingfield. We're going to hear all about the wonderful benefits of the sun and also the ways that it can impact us in a way that we should be protecting ourselves here at this high altitude. We love soaking up the sun, and I've worked with Cherie for many years and have also seen that UVA and UVB do have carcinogenic effects, and we, live really close to that beautiful ball of flaming light. So we'll learn a lot more about that. And we've also had Anne Krogan come join us, so we're looking forward to hearing her speak after Cherie. Well, without any further ado, I would like to bring to the stage Cherie Bedingfield with Salina Dermatology. She is an amazing PA doing incredible work in Salina, helping us all feel better about our skin. And she's going to give us a wonderful talk on skin care, prevention of skin cancer. And here she is. Cherie, welcome.
Thank you. Thanks so much for being here. And I'm feeling not quite as prepared as Bronwyn. I was really impressed with both of the parts. So I'm just going to talk a little bit first about my approach to sun protection, and then I'm going to go into a little bit about the different types of skin cancer and what to look for and how to kind of tell maybe something that may be a normal growth from concerning growth. And then I'm also located at this table, and if somebody has anything specific that they'd like for me to check out, I'm happy to do that here today. So I want to say first and foremost that I am really, really drawn to the sun personally. I love to be outdoors. On the days that I'm not in my office, I'm on my bicycle or on a trail or in my yard. And so I come from a place of understanding that, like, for myself personally, my joy is outside. And so I think a lot of people have this idea that in order to protect themselves from sun, they need to stay inside. And I just am never going to be able to live that lifestyle. It's always interesting to me because so many of my patients are outdoor oriented. And then occasionally I'll have a patient where I say, you know, what do you like to do outside? And they say, oh, I don't really go outside much. And I think, well, what do you do? I don't even know what people do that don't go outside much. I mean, I guess they cook or quilt or watch TV, but that's not the way that I want to live my life. So my approach is first and foremost to do the things that bring you joy, right? We all know that being outdoors is really good for our brains. It's good for our spirit. It's good for our body. The more that we move and spend time in the wilderness, in the woods, on a river, near a stream, all of that just makes us healthier, happier human beings. So in doing that, how do we then limit our risk, right? Because as Alicia alluded to, the sun is a ball of fire, right? And it emits UV radiation. And that UV radiation, unfortunately, is carcinogenic. So every day that I'm in the office, I typically do 2 to 3 surgeries a day. And those are just removing skin cancers, which are the most common cancer for both men and women. So most of the skin cancers that I'm removing every day are basal cell or squamous cell. Those are directly related to UV radiation. Melanoma is somewhat related to UV radiation, but there's a large genetic component, so it's not quite as clear, that link. Melanoma certainly is the most dangerous of the 3 types of skin cancer, and I'm simplifying this to 3 types of skin cancer. There are numerous others that are much less common, but I want to keep it pretty understandable and basically everybody can come away with the idea that basal cell, squamous cell, basal cell is by far the most common skin cancer and most common cancer for all people in the United States. Especially in Colorado, one of the things that we like to do is to be outside, and we have a lot of people that are at high altitude, and so then our rate of skin cancer in Colorado is much higher. So how do you go about living this life of joy and protecting yourself? So the way I think about it are there some pretty simple strategies. One is to think about what time of day and how strong the sun is. You can also use what's called the UV index, which is going to tell you how intense the UV radiation is. I think it's pretty simple to think that in Colorado at high altitude, we usually have a pretty high UV index. So usually before 10 a.m. or after 3 p.m. are going to be the times of day where you're going to have less intense UV radiation. So when I mountain bike in the summer, I try to do my ride early. I might leave the house at 6 or 7 and have my ride done by like 10:30 or 11, right? It's harder when it's cold outside and you really want to go out when it's the warmest. But as far as kind of cleaning activities, if you're taking your kiddos to the sand dunes and they get up early, go early. Be done by 10 or 11 o'clock. The other thing is that, so time of day makes a big difference. And then if you can seek shade during that more intense time of UV radiation, that's a really good strategy. Sometimes there's a misconception that being in the shade means you're not going to get any UV radiation. So I do want to dispel that myth a little bit, especially since I was just talking about the sand dunes, and there we're going to have a lot of reflective UV light, sand, snow, water. Oftentimes then, even if you're in the shade, you're getting a lot of that reflective UV light. So, but sitting in the shade is always a good choice. If you go to the playground with your kiddos and you're looking at where are we gonna put our stuff, I have this blanket, I have these snacks, just pick a shady spot so that your central place that you're hanging out is in the shade. I'm a huge fan of sun protective clothing. So long sleeves, big hats, gloves on your hands. They make these really cool, Buff makes a really cool glove that's like a fingerless glove. So if you're hiking or rafting or doing something like that, it's pretty easy to cover the back of your hands, which is a place that we see a lot of cancers. Also, there's a tendency to want to, of course, wear like a baseball cap or a visor, and that just isn't doing much to protect your ears or your neck or the sides of your face. So getting a broader brimmed hat. I remember when I first made the shift from my cool baseball cap to my not so cool big hat, and I was going to a soccer game with my kids, and my kid looked at me and said, "So are you going to wear that hat, Mom?" I was like, yes, because I need to be a good example, and also it's the right thing to do. And within like 6 months, I was not the only mom with a big hat at the soccer game. But it is just, sometimes it's hard to make that shift into something that we don't think looks as cool, but they do make really good broad brimmed hats now. They have really cool felt hats, just find one you love and wear it. The other thing that is a good way to protect yourself on any skin that is exposed is, of course, sunscreen. And there's a lot of controversy about sunscreen. I agree that there are some ingredients in there that we want to avoid. But in general, I'm a huge fan of the mineral-based sunscreens. So zinc oxide, titanium dioxide, those are physical blockers. So it's not that chemical sunscreens are bad. Some of them have a little hormonal disruption tendency, and we want to avoid those. But in general, the zinc oxide is very safe, right? We eat pumpkin seeds that have tons of zinc. When we're getting a cold, we take zinc lozenges. None of us are worried about putting zinc in our bodies, and we certainly shouldn't be worried about putting it on our skin. The cool thing about the mineral sunscreens is that they have reflective properties. So when this UV radiation comes down and it hits the skin, it's just going to bounce off. Whereas with the chemical sunscreens, they absorb the UV radiation and change it. They change the energy. So I'm a really big fan of the mineral-based sunscreens. The downside of mineral sunscreens is that they can look white, right? And none of us want to have our ghostly appearance when we just want to go hang out at the park and meet some friends. So they make actually transparent zinc oxide. So the difference is that the transparent zinc oxide is micronized, which means if you think about zinc being a particle that's like this big, and our eye perceives that as white. When they break that particle down into smaller particles, then once it goes on, it's no longer visible as white. So there's like, maybe 10 seconds that it's white on the skin, and then it's clear. And that's because our eye isn't picking up the big particles. Now, this is not nanoparticles, so nanoparticles are even tinier, and we don't really need nanoparticles in order to have clear zinc. So what I would say is look on the bottle if you're trying to figure out in that big aisle at the city market or Walmart and it's overwhelming. You want to look for something that says clear zinc or micronized zinc, and you want to see maybe that it has that as the main ingredient, right? So typically 7%, 9% zinc oxide is going to be a really good sunscreen. The other part about sunscreen that most of us don't do as well as we could is reapplication, right? So it's ideal to get your sunscreen on 30 minutes before you go outside. Although if you haven't and you're going outside, don't let that stop you. What's that? Like, don't let perfect be the enemy of good, right? So do the best you can. If you're headed outside, you're like, oh shoot, I need my sunscreen. Put it on, that's great. You're gonna get some protection, and in 30 minutes it'll be even better. But what you wanna think about is if you're outside for more than 2 to 3 hours, you need to reapply. And that is where most of us get busy, we're having fun, we left the sunscreen in the car, we left it at home, we don't think about it. So just strategizing, in my mind, typically if I'm exercising or I'm doing something outside and I'm more than a couple of hours, I'm gonna need some food. I like to have snacks. So if I need a snack, I'm also gonna think about reapplying my sunscreen. And then also have forms of the sunscreen that make it really easy to reapply. They make those awesome sticks that are kind of like a crayon, so you don't have to get lotion on your hands if you're fly fishing or you're hiking. You can just kind of unscrew it, crayon it on, and call it good to go. The other part that I failed to mention, but as far as sun protective clothing, we make these really cool sun hoodies now, which are lightweight, they're long sleeve, they have a hoodie, and those are great. They've become really popular with raft guides and fishing guides, and you see them on trails with mountain bikers. But they don't have to be expensive. You don't have to have the $80 sun shirt. The $15 sun shirt that they sell is also really effective. So just think about, like, maybe investing in a couple of those so that when you are doing those outside things, you have those that you can grab and throw on. Let's see. The other thing is there's a supplement which I think is really interesting, and it's called HelioCare. It's actually a fern extract. It's called Calpodium cotomus, and it's something that when you take it on the day that you're outside, it gives your skin additional sun protection. So this is not instead of sunscreen, this is in addition to. But if you think about how intense our UV radiation is here, this is a nice add-on. I'm really thrifty, so I don't take this every day. Let's say I work 4 days a week and I'm outside 3 days a week. I'm going to take it on the days I'm outside because I work all day. But, if somebody's like, oh, I'm retired, I go outside part of the day, I don't know, it may be a good idea just to take it every day. They only sell it at Walgreens and online. And I do have some samples back there, and I also have some coupons, because like I said, I'm thrifty. So I think it's like $3 off the choice. The other thing I want to touch on is the idea of vitamin D. Obviously, vitamin D is really important for our health, right? And a lot of people will say to me, I'm really careful with my sunscreen, and then I go outside for 10 minutes a day to get my vitamin D. Well, it's really interesting because everyone processes, it's actually a conversion from vitamin D2 to vitamin D3 that occurs in the skin. Everyone is different. They did some studies on Norwegians, and they had some get 20 minutes of sunlight every day, and some got no sunlight every day, and they tracked their vitamin D levels, and they found no consistent improvement in the people that were getting the sunlight every day. Some of them really had a lot of improvement, others had none, and that's because people just process vitamin D differently, and they convert differently, and so there's no I would say there's no insurance that if you're getting 7 minutes of sunlight or 10 minutes of sunlight, that you're going to have the appropriate amount of vitamin D. I'm a huge fan of getting your vitamin D serum levels checked, because then you know where you stand. So most of us would benefit from a vitamin D supplement. There's a lot of good evidence that vitamin D can be beneficial to your health in so many different ways. So what I encourage my patients to think about is, can you get a vitamin D level checked, take the appropriate amount of vitamin D recommended by your primary care provider, and then check it again and make sure that if you needed some improvement, that you've gotten to where you need to go. The other thing I think about is, let's say, we know that UV radiation is carcinogenic, right? We've established that. You can get vitamin D with a supplement, so that's very safe. So if I said, you need vitamin C, which you could get from cigarettes, or you could get from oranges, which is going to be the healthier choice, right? So you don't have to get UV radiation in order to have a healthy amount of vitamin D. So I would say just remove that from your equation of how you think about sun and sun exposure. Most of us are getting way more sun exposure than we need for vitamin D, even when we're being careful. So don't add that extra element of like, oh, I lay out extra refrigerator for 10 minutes to get my vitamin D. The other thing I really want to talk about is what to look for on your own skin to kind of identify if there's anything that you might want to be concerned about. So certainly anything that looks like a sore or a pimple that doesn't heal over time, or even a wound. I've had people come in and they said, you know, I was working in the yard and I poked myself with a branch and that was 10 months ago and I still have this sore here. So sores typically from like a wound are going to take up to 2 weeks to heal, maybe 3 weeks. But if something's sticking around longer than that, then you would want to think about potentially that might be a cancer or a precancer. So sometimes precancers and cancers, they'll look red, they'll bleed, they might scab or crust, or feel a little dry or scaly to the touch. Anything that I think in my mind is going to be persistent more than a month to 6 weeks. One good thing, we all have these cell phones now, so you can actually take a picture of whatever it is that you're concerned about, write something in your calendar, and check it a month from now, right? Oh, that spot's gone. Great. Or darn, it's still there. Maybe I should go have it looked at. Obviously, the most concerning cancer that we talk about is melanoma. Most melanomas are pigmented, meaning they're brown or black or dark blue, and they look irregular. So if you have a mole that you've had since you were 7 years old, and it's always been brown, and then one day you look down and you think, that looks darker, or the pigment is changed a little bit, or the border is irregular. Those would all be reasons to get it checked. I do think when we think about cancer screenings in general, we know that skin checks and colonoscopies save the most lives. And I would just like to remind you that a skin check is much easier than a colonoscopy, but you should definitely get both. But you don't have to do any prep other than maybe show up for the appointment. So we're easier in that sense. And skin checks are just, they're relatively painless. You get in a gown, somebody looks at you, it takes 15 to 20 minutes. It's really just a really good way to get a good baseline, get checked every year, and hopefully prevent any cancer or treat something early if it does come up. One of the biggest things that we know is that melanoma, when it's caught early, has a very, very positive survival rate, right? Most of the melanomas that I catch in my office are definitely stage 1. Which means that we can remove it in the office. All you need is an incision. We don't have to check lymph nodes. You're not looking at chemotherapy or radiation or anything other than an unfortunate, piece of your skin is gone and you have a scar, like some stitches and just like a linear scar. So it's incredibly important that you catch it early because later stage melanoma has not a good survival rate. Better now with some of the new medications that are available, but obviously if you can avoid that by catching it early, that's the best part. I'm going to be back here if anybody has any questions or you have anything you'd like me to look at, but I'll also just open the floor if anybody has any questions now. Anything you'd like to know that I didn't mention about sun protection, skin cancer, or having fun outside? Okay.
I have a question.
Yes.
What is the best type of sunscreen to use?
Something with zinc oxide. Thanks, Alicia. All right, thank you so much for having me.
I would like to introduce our next presenter, Ann Krogan. And Ann is an expert on pelvic floor health. She works with Heart of the Rockies, and she also has her own private practice for home visits for postpartum and all sorts of other needs. So she's going to talk to us about help with the 3 Ps, pain, pooping, and peeing. So let's all do a Kegel, at least 2. And I'll turn it over to Ann.
Okay, like Alicia said, I'm Ann Krogan. I'm a clinical doctorate in physical therapy, and then I specialize in obstetrics and pelvic health. I work at Heart of the Rockies in their outpatient clinic, and I also have my own clinic. Alicia's gonna pass out a handout that has a lot of the things we're gonna talk about on there, and then that way you don't have to remember everything. Okay, and then I don't know that it'll take the whole hour, but I did plan on time for questions, so I'm really hoping that we have some good questions, because that'll drive a better understanding. So the first thing I want to talk about is peeing. And I made this, I tried to design this too for men, so hopefully our men out there are listening. So the first thing I want to go through is anatomy. And I'm a PT, of course, so anatomy is really important to me. So I brought my model, and the men is actually just the same. Women just have an extra hole. So the muscles for the men are the exact same. So the pelvic floor, or as a lot of us call it, the Kegel muscle. The Kegel muscle is named after Dr. Kegel, and I have a hard time naming things after men. I'm sorry, men, but like, why do we gotta name ourselves after them? So I like to call the pelvic floor muscles instead of Kegels. And it is Kegel, not Kegel, because it was his last name. So there's a couple of layers. The two that really matter when we talk about bladder function are the first layer. So it's just what you see, there's just skin on this layer. So for women, you have the clitoris, the urethra, vaginal opening, perineum, and then rectum. And then for the men, you just don't have the vaginal opening. And these muscles for the women and the men are the same thing, but for the men, they just form out into the penis. So the first layer of pelvic floor muscles are really responsible for maintaining continence, so you don't leak urine when you cough or sneeze or jump. So if you leak urine during those specific activities, then usually that's a problem with this layer. The deeper layer of the pelvic floor, when we really think about a Kegel, the deeper layer of the pelvic floor is that mindset. It's shaped a little bit like a bowl, and it connects to our tailbone, and then comes forward like a hammock to the pubic bone that's in front. And the organ, the urethra, the vaginal opening, and then the rectum all have to pass through that. So when we think of like deeper pain, this is usually the layer that's more the problem. When we think of prolapse, this is usually the layer that's more the problem. We'll go into some more pieces on the pelvic floor, but that's basically those two layers. Any questions on those two layers? Okay. So the bladder is really cool because it's just a muscle, and it rests in the pelvis, right at the pubic bone, so it's just right there. So what's really neat when we think about, especially for women, prolapse is when things feel like they're falling out of the vagina, or they are falling out of the vagina. Because the bladder rests on the pubic bone, if we have good posture, then the bladder has this really great bony backdrop, so that gravity doesn't pull at it so much. But if our posture isn't so great, then the bladder loses some of that bony backdrop. So as PTs, we really love to talk about posture. It's like our favorite thing. And this is a really good example of how if you're slumped, it can lead to more that bony backdrop being lost for the bladder, and it can come more into your pelvic floor. Women, especially during times of breastfeeding and postpartum recovery, breastfeeding is really hard as an activity of daily living if you're doing it all the time. So making sure that like when you're sitting on your sit bones, and we're not too slumped, because we're at risk of prolapse during that timeline. I know, sorry, you don't have to. Not pointing you out. So it's just, that's part of of the posturing, especially essentially during that time frame of recovery, because there's so many things going on hormonally for women right after they have a baby. And one of those things, especially with breastfeeding, is that the vagina, this is deviating just a minute from the bladder, but this is the uterus and the vaginal canal, and the bladder anatomically rests like that. So the vagina really loves estrogen. It's like its favorite thing. And so for women with breastfeeding and perimenopause, menopause, the vagina is a muscle, and it's just really likes to hold everything up, and it's really strong like this. But when it starts to lose some of its estrogen, it allows things to come into the space, the vaginal opening a little bit. So that's menopause, breastfeeding, perimenopausal, that will start to happen. So sometimes urinary incontinence or leaking urine is because the bladder is coming more into that space. So with estrogen, you could do an estrogen replacement, and brown one is great for this too, by the way. So if you do an estrogen suppository or something like that, it bulks that tissue back up so that it does a better job of holding the bladder up. And I think it's super helpful if we're having a lot of prolapse symptoms, especially around those 2 time frames, to help give the vagina just a little bit more estrogen so that it can better do its job. The estrogen does a lot of things. It can help with vaginal dryness, things like that. But keeping the bladder where it's supposed to is really important. So that's one of those pieces of that. So the bladder is really just a muscle. And it's a muscle that as it fills, it starts out really small, and then as it fills with urine, it gets bigger. And then when it's time to go to the bathroom, it contracts. The pelvic floor relaxes, and then you can urinate. So when we have different pathologies like urinary incontinence that's related to urge, which is more of a oh no, I really, really gotta go. And you're doing that to try and make it to the bathroom. The bladder is having a hard time communicating to the brain how to stay, how to not go through the spasming and squeeze out urine. So we'll get to that here in a minute. I want to make sure I got all the anatomy pieces. We talked about prolapse. Oh, for men. So I brought my male bladder model, and so this is, the only difference with the men and the women is that there's the prostate for the men, and the urethra has to go through the prostate. So men can have more of an issue later in life with prostate enlargement. And then if the prostate is removed, one of the sphincters that keeps continence without our brain knowing it lives in the prostate. So when the prostate is removed, men can lose continence momentarily because that sphincter has been removed too. And then it's really important to go to pelvic PT and learn how to use the other sphincter that you still have so that you don't leak urine. At Heart of the Rockies, we have a really great program for men who are going to undergo prostate surgery. And so we like to see them before they have their surgery and then after, just so that their outcomes are better. But that's the only difference really with the male bladder. Okay, so I think normal is really important to talk about because a lot of people don't actually know normal bladder behavior. But it's important for the bladder to go to the bathroom 5 to 8 times a day. That ends up being every 3 to 4 hours. And 0 to 1 time at night. And the 1 time at night, I only give that to moms right after they have a baby, and then maybe if you're 65. So you should really only be going 1 time at night. So if you're going more than that, we need to fix some things. And then no leaking either. It doesn't matter how full your bladder is, you should not be leaking urine. So I like to think about the bladder as if it's a 3-year-old. And I think if we really view the bladder like a 3-year-old, it helps us to understand it and talk to it a little bit better. Does everybody know a 3-year-old in their life at one point or another? Okay, good. So this will work for you too. So all 3-year-olds really want is just to be loved and cared for. And this is how our bladder feels. It just wants us to love it and not be mad at it. 3-year-olds also really love boundaries. They like to know when it's okay for them to do something or not do something. Without those boundaries, they feel a bit dysregulated, and then that's when we get more outbursts from 3-year-olds. So the bladder is similar. The bladder likes to know when is it okay to go to the bathroom and when is it not okay to go to the bathroom. And if we haven't really established those boundaries in a loving and compassionate way, then our 3-year-old will throw a fit, and for the bladder, throwing a fit is always leaking, or having some sort of pain, or saying it needs to go to the bathroom. Because the bladder doesn't know how else to communicate to us other than leaking or saying, I need to go to the bathroom. So, if you just think about it like a 3-year-old, it'll make more sense. So I'll come back to the 3-year-old here in a minute. So things that are not so great for the bladder, or things that can irritate your 3-year-old: alcohol, carbonated drinks, caffeine, dairy, dehydration, processed sugars and foods, tight pelvic floor muscles, scar tissue, and abdominal surgeries, hip problems, back problems, wearing pads, constipation, or just in case pain. So, and if you look this up online, there's like 100 more items on that list. So I just took a few of them. And these aren't things that apply to everybody, by the way. Like, we're all different in different bodies, so some things will irritate some people more than others. But that's a pretty good list to start with. So one of the ones that I want to point out is dehydration. So a lot of people will purposely keep fluid, like not drink, because they're going to go on a plane ride or something and they don't want to have to go to the bathroom a lot, so they won't drink a lot of fluid, or they'll do that during their day. And the bladder just really hates that. The bladder likes to be hydrated, just as the rest of our body. And so unfortunately, that's a bit of a catch-22, so you'll get stuck in a cycle of maybe more leakage and more urgency because your bladder doesn't have the water that it wants, and it only knows how to communicate to you through saying, I gotta go to the bathroom, or leaking, and so it'll do that when it wants water. So we have to give it enough water. Tight pelvic floor muscles is the other one that surprises people a lot, so I want to talk about that here for just a little bit. So we come back to our pelvic floor. Everybody thinks that a tight muscle is a strong muscle. And so therefore, if I'm leaking urine, that must mean that I have to do my pelvic floor exercises or my Kegels. And if pelvic floor PT was all about Kegels, I would not have a job, because you guys are all perfectly capable of doing Kegels. But the problem with it is that sometimes in a response to trauma or in a response to carrying a lot of stress and tension, the pelvic floor holds really tight. And the bladder just doesn't like that pressure on it. And so because of that, the bladder can send the signal that it really needs to go to the bathroom or leak. And tightness does not mean strength. So a person who has a stroke can have a tight muscle, but they are not strong. So the pelvic floor, again, is similar. Just because it's tight doesn't make it strong. So when we breathe, and Sheree brought this up earlier, so what was that lady's name again?
Oh, I don't remember her name.
The buff muff? The buff muff. Sheree found this great lady online that called the buff muff, and I'm excited to go listen to her stuff. But she talks a lot about breathing, and breathing is really important for the pelvic floor. So if we think about the pelvic floor like my bicep muscle, when it's all the way open, that's like having a bowel movement or having a baby. When it's all the way closed, That's like it clamping down because you coughed or sneezed. But normally, the pelvic floor lives in this in-between. And when you inhale, it opens a little, and when you exhale, it closes a little, and it's always doing this nice wave. And it actually follows your respiratory diaphragm. So when your respiratory diaphragm, when you breathe in, it opens. When you breathe out, it closes. So it's a bit like a car piston going up and down on each breath. So when we get stuck in like a stress or trauma response, sometimes we stop breathing with our respiratory diaphragm, we start breathing with our belly or our chest. And that stops that waving, which causes the pelvic floor to pull into more of tension and tightness and not move. And it's really hard to maintain continence when the muscle has nowhere to go to stop urine. So that's how sometimes stress or trauma can also lead into urinary problems. So good diaphragmatic breathing is key. Not belly breathing, not chest breathing, but diaphragmatic breathing. Okay, just in case peeing. This is one that I like to talk about because a lot of people just in case pee, and this is something we can blame our moms on because they all taught us to just in case pee. That's how we were potty trained, but now we know better, we do better. And what we want to do with kids in potty training is actually like getting them to learn their internal signaling of, oh, I need to go to the bathroom, instead of, oh, we're going to go to the store, so you should go to the bathroom, and then I'll give you an M&M while you're on the toilet, so then they learn this like reward behavior, and then we'll go. Or, you know, you're going to go on a road trip, so you have to go to the bathroom first. So when we start that just in case peeing, we don't actually teach the bladder to tell you it needs to go. We teach the bladder, hey, I go every time I put my key in the front door. That's when I want to communicate that it's time to go. And so that's the brain confusing the bladder. And remember, the bladder is just a 3-year-old. You don't want to confuse it. You have to be really clear with your boundaries. We only go to the bathroom when. And so then that just in case peeing is just really confusing. And the bladder is like, I don't even know what this lady wants from me anymore. I guess I'm just going to have to go. And it creates this Pavlov's dog response. So try not to just in case pee. The only time I say it's really okay is before you go to bed. One time before you go to bed. Not like, oh, I went and then I brushed my teeth and then I laid in bed and I read a book and then I got up and I went again. No, like cut out the one before you brush your teeth and just do the one right before you go to sleep. The bladder, how it works is, I don't think I went into this, week 3. So this was up earlier at anatomy, I missed this part. So the way that the bladder works is it fills to a certain level, and it's the same fill line every time, and then it tells the brain, hey, I have to go to the bathroom, and the brain says, no, you don't. You went an hour ago. You'll be fine. And because the bladder trusts the brain, the bladder says, okay, you're right, I don't need to go. And then a little bit later, like 3 to 4 hours later, the bladder fills to a new line, and it says, hey brain, I have to go to the bathroom. And the brain says, oh yeah, you're right. You do have to go. It's been 3 hours, but we're in the middle of this really amazing talk by Ann right now, so you can't go now. You have to wait. And because the bladder trusts the brain, the bladder says, okay, I'll wait. And then the brain always lives up to its promise, and it takes the bladder to the bathroom, and it sits on the toilet, and it says, okay, now you can go. And then the bladder gets to go. So that is how it works normally. So just in case peeing messes with that, because if the bladder knows, I get to tell her I go here and I go here, but the brain is going all these other places, then the bladder can't trust the brain. So when we go into what things that are good for the bladder, one of those things is urge suppression, so like suppressing the urge of the bladder needing to go to the bathroom if it's outside of the boundary time of when we go. So if you went to the bathroom and 45 minutes later, your bladder is like, hey, I gotta go to the bathroom, and you're like, just went, but I really have to go. I'm being really irritated right now, and you start doing the potty dance, and you're moving around like this, and you can't really hold it anymore, and you're trying to make it to the bathroom, and your brain is starting to lose it. You're like, I'm waiting in the store, and I really have to go. And that is when you're most likely to leak, because you don't have any calm confidence that helps the bladder trust the brain in knowing what time it is and what are the boundaries on when we go to the bathroom. So calm confidence is the first thing on there that's good for the bladder. How many of you guys have watched Caesar, the dog whisperer? Is he still popular? Okay, good. I love him. He just talks about, dogs and how you have to be really calm and confident with dogs. And so I took that and I like to use that when I talk about the bladder. Because if you are trying to help your 3-year-old feel loved and safe, and you're not calm and you're not confident, that 3-year-old absolutely will not listen to anything that you say. So even if you fake it until you make it, you have to pretend to be calm and confident with your bladder. So if your bladder, it's been 45 minutes, your bladder is saying to you, hey, I really gotta go, you get calm, you get confident, and you say, no, you don't. You just went 45 minutes ago. I know that you just had coffee, which is why you're being irritated right now. But we need to calm down. We can't go yet. So you give it the boundary, you name its feeling, right? Because it's just a little 3-year-old. Sometimes you have to mirror the feelings back to it and say, I know you're just really irritated because you had coffee, but it's still not time to go. So when we do the calm, confident, it helps the bladder listen more. And at first, if you are a person who leaks every time you walk into your front door, that calm confidence is really hard to train. And I tell people who I'm working with, when you start that calm confidence training with your 3-year-old, you will not be successful the first couple of times. Maybe the first 3 days, it will be pretty awful. Because if you have a 3-year-old who's been allowed to get away with everything, and then you suddenly give them boundaries, they're going to rebel against you, absolutely. So your bladder is the same way. When you first start to give it boundaries, you will leak, and it will get worse. But it only takes a couple of days of sticking to your guns on what your boundaries are, and you being calm, and you being confident, and your bladder will slowly start to trust you again, and stop leaking on you with the urgency. So, wearing a pad or staying at your home while you do those things is helpful, so that you're not trying to do that in the store and then you have an accident in the store. Pads, I forgot to mention pads. Pads are kind of a catch-22. I mean, they're helpful so that we don't have to change our clothes, but also our brain knows that it's there. And so sometimes our brain doesn't try as hard as it could to maintain continence. And they increase our risk of UTIs, plus there's a bunch of chemicals in pads, and it's kind of a waste of money. Okay, abdominal mobility. This goes a little bit to the not so great for the bladder. One of the things I mentioned was scar tissue. And abdominal mobility, if you've had any abdominal surgeries, including a cesarean birth, that is a lot of scar tissue in your abdomen. So the bladder does not like the restriction of scar tissue. It really bothers it. So if you have had any abdominal surgeries, you just need to rub your belly. Getting some nice magnesium cream is always great. And rub your belly to the center, being your belly button. And that just helps to start to give more movement back to your organs so that they can feel more loved and calm and safe and have good movement. And then you're going to do your breathing, and everything's going to move with that too. So the bladder really loves for you to rub on it. Hydration, I mentioned that earlier, so I'm suggesting 65 to 80 ounces of water a day. you know, especially living here. I know, right? It seems like a lot. Especially living here. So my strategy, because there's no way I would be able to count however many glasses that would be in my life, I fill up 2 water bottles a day that are like 36 ounces, and I fill those up in the morning, and then I make sure that those are gone by the evening. And then I will still have a glass of water in the morning before my coffee, and then I will still do a glass with dinner. So that's my strategy, because I have 3 kids, so there's no way that I can keep track of all that. Yeah, that's such a good question. So breast milk is 98% water. So if you are not, and you think, like, how often is your baby eating a day? Babies take in anywhere from 1.5 to 3 ounces per feed. Per ounce basically of water, right? So whatever that is, plus more. Yeah, I mean, don't overcomplicate it, but think about, like, you're basically just like giving away your life's energy. You're liquefying your body. It's amazing. But like, and remember too, like, babies will always be okay. We're the ones that may not be. They'll be fine. But our body will basically liquefy all of it, muscle, like all the nutrients that it needs from everywhere to make sure our little being survives, which we're so thankful for, but also, like, you matter. So make sure you have all those pieces in there, yeah. More water. And like electrolytes are really important too. Yeah. Warm lemon water with real lemon is a nice trick for the bladder. The bladder loves lemon. And sometimes people hear that like citrus will irritate the bladder, true. But for whatever reason, if we squeeze some lemon and some warm water, it helps to calm down the bladder 99% of the time. So I use that for people as a trick before bed. Always sit on the toilet, don't hover. Most generations now don't seem to do that. Some of the older baby boomers were still hovering, but that seems to have stopped. The reason for that is, remember when I said earlier that the bladder contracts and the pelvic floor relaxes to let urine out? So if I'm like holding a squat, my pelvic floor is really tight. And so, because it's stabilizing me, it's working as a muscle. But the bladder is like, wait a minute, what does she want? Does she want me to go? Does she want me to stop? And it gets confused because it's like, you're supposed to relax and then I contract. So don't hover over a toilet. If you're in the woods, they make these really great things called chiwis, where you can like put it up and it's a bit like a penis and you can stand and pee. So you do that, or if you got into a full squat, that would be fun. Because that is a relaxing position for the pelvic floor and a good stretch, but not hovering. Another trick that I have for people who have prolapse of the bladder, so sometimes leaking will occur because urine gets stuck in the urethra, and that's just essentially, I like to think about it like a kink in your hose. So if you're out watering your garden, you turn off the hose, or you have a kink that gets into the hose and the water stops and you unkink it and then water can come out. Or if you turn off your hose, you know, and then you go to move it, like some will dribble out. So if you think about your bladder in the same way, if it's prolapsing and falling into the space, you essentially kink it. And then you get up off the toilet and you move, and then maybe a drop or two is on the toilet, or as you're walking, a few drops come out. Well, that's not incontinence as in you're just completely leaking. That's because something got stuck in your urethra. So my trick for this is having people lean forward, stay forward, sit, and then go. If you lean forward, come back up, sit, then you've essentially kinked it again, so you have to stay forward. That helps a lot. It also helps decrease frequency, because if there's urine stuck in the urethra, the bladder is going to keep telling you it needs to go, because it doesn't want urine stuck in there. It doesn't want you to get a UTI. So that forward lean really helps a lot with a lot of people. No Kegels with urination. Don't do that. We used to say that, German nuts. You guys can say that, right, Ronna?
I don't say
say anything about Kegels. I couldn't.
Yeah. Yeah, back in the day, doctors used to say, to know if you're doing a Kegel correctly, you should, while you're urinating, contract your pelvic floor. And it's really confusing to the bladder because the bladder's like, wait a minute, I thought our boundary was here. We went when there was relaxation and we're on the toilet. Why are you telling me to stop? And so it gets really confused and it doesn't know what to do, and then it just decides to leak. So when you're urinating, you're not practicing pelvic floor contractions. Okay, so urge suppression. So for those of you who have problems controlling urge, meaning when you have to go, you really have to go, and you would leak with that, or you feel like you have to rush to the bathroom. So first of all, what's happened is we've lost our trust with our bladder-brain connection. So we need to rebuild that loving, trusting relationship with our bladder. And part of that is listening better to each other. We go, in my sessions, we really take a deep dive into this esoteric consideration that the bladder is like a 3-year-old and we have to build up a whole trusting relationship. But another way that you can help calm the bladder down is by doing pelvic floor contractions or Kegels, because tightening of the pelvic floor muscles tells the bladder to stop urinating. And so that'll help calm it down so that hopefully you don't leak. The other one is a forward lean. So you could lean forward and do a couple Kegels this way or pelvic floor contractions. And the reason why that helps is because you just use gravity to get the bladder away from the pelvic floor a little bit. You get some traction on the bladder. It just helps it to calm down. Using gravity helps it to calm down. And you can scrunch your toes. So if you scrunch your toes, it sends a signal to your bladder to be quiet because of where the toe muscles and the pelvic floor muscles live in our brain. And then the one that I feel like for people who really leak a lot is it's really helpful to lean forward, do a couple pelvic floor contractions and some toe scrunches and say, bladder, I am on my way to the bathroom. I promise you, I will take you there. You just need to stop leaking.
I need to sucker.
I know, it's just and then stand back up and take a few steps, and then if it starts, no, bladder, I'm on my way to the bathroom. And eventually, and you can talk out loud or not, but eventually, on your way, like through that training, it'll learn its boundaries and it will behave better. And next time you guys are at Walmart and you see somebody walking and like pretending to fix their shoe, you could be like, ooh, they're doing their urge suppression. Okay, that was peeing. That was kind of a lot. Do we have questions?
No, this is awful.
I'm not a woman and I don't love this about the women, but it's like similar to male prostate, steam gland. Is that what you're talking about? Contraction, is that what you're talking about?
Yeah,
Okay,
it's
contraction.
essentially the exact same.
Okay, just double checking here.
Yep.
Terminology.
Yes.
So I have a question about flow. Sometimes, like, I'm like, I really have to go to the bathroom, and it's like, bam, I'm done, and it flows, and it's good. And then other times, I really have to go to the bathroom, save emergency, and then it's like, and I'm in a hurry, and then it just wants to get started. Like, why do I do that sometimes? Especially when I'm in a hurry.
Yeah, so, okay, great, yeah. So her question is flow, and why sometimes it's good and sometimes not so good, and why does when you gotta be somewhere fast, is it hard? Yeah. So I think there's a lot of layers in there, but so starting with flow, if you go back to the kinked toes idea, one of the symptoms of a prolapse or your bladder falling into the vaginal opening is a flow that's distorted or different. So when you sit down, your bladder your pelvic floor relaxes, bladder contracts, and everything should just come out as a nice good stream. It should take like 8, 10-ish seconds, somewhere around there. If it sputters off to one side, that's probably because the bladder is falling into the vaginal opening, and then however that's showing up mechanically for the urethra is coming off one way. It could be scar tissue, so it could have been birth trauma. So those are usually our reasons for and also like a dermatological condition too. Could also be something from that. There's a couple of conditions. There's one called lichen sclerosis, which we tried and sent to Cherie before it becomes too much of a problem, but that can like scar down on the urethra too. That skin condition, and that can change the flow. So the urgency piece, it could be maybe that your bladder wasn't as full as you thought it was, so it's harder for it to go through its contraction. Could be scar tissue. Scar tissue, especially like a cesarean birth or any abdominal surgery, for a cesarean birth, there's scar tissue in front of the bladder and then scar tissue behind the bladder because they had to go through the skin, they had to peel apart muscles, they had to pull the bladder out, they had to pull the uterus out, they had to make an incision, put the uterus back in, put the bladder back in right on top of that incision from the uterus. So now there's scar tissue between those two. And then they finish sewing up the front, which is now scar tissue between the bladder and the abdominal wall. So then when the bladder tries to contract, it's like pulling against all of these different areas of scar tissue. So that could possibly be, and sometimes it could bother, maybe sometimes it couldn't, depending on like how full it is. Does that feel like that answers the question? Okay. Yes, shoot.
Can I say also some medications, like antihistamines or something?
Yeah, that's a really good point. Thank you. Yeah, sure you said some medications, antihistamines. Any other urinary questions? Yes.
What about, you have some problems sneezing sometimes. You have it under pretty good control, and you get a cold with a cough. And you're coughing, and it's like it will just blast through that bladder control.
Yes.
Is there anything?
Okay, good question. Yeah, so her question is about coughing. Sometimes coughing is just not fair. Like it's just not fair.
The 3-year-old would say that.
The 3-year-old would say that, really? Yeah, coughing is hard because coughing, especially like a few coughs is fine, but when we've been really sick, it's testing our endurance. Yeah.
And then deep cough increases the pressure
Yes.
inside your abdomen, and then the pressure just goes straight up.
Yes. Right. Pressure. So, because the bladder, like, there's pressure from up top pushing down, like during pregnancy is a good example. That will push urine out, right? Coughing really tests our resilience, and especially of our pelvic floor muscles. So, if you get a really bad cold and you're leaking during that, just give yourself some grace. After the cold, if you're still leaking, then we should fix it. And we need to work on, so in PT, we work on muscle strength and endurance and coordination and power and all of that. And the pelvic floor is just a muscle that needs to learn all those skills too. So you could do Kegels and pelvic floor contractions and maybe hold them. And don't forget to do your Kegel before you cough or sneeze if you can remember. Yeah, and then the other trick too is like if you're able to sneeze and you're able to put pressure out your abdomen instead of down, that'll help. My trick when I've been coughing or sneezing a lot is I'll actually lean forward because that helps me to do a really good pelvic floor contraction and then my bladder has some space. Some people do this. I'd rather lean forward. Yeah, and some people that doesn't work because all you're really doing is tightening your inner thigh muscles. Mm-hmm. Any other questions? Yes. Yeah, really great question. question on prolapse and not avoiding surgery? Yes, so pelvic floor PT, this is our jam. Yes, there is. So first of all, it depends on what stage of life you're in, but this is coming back to the estrogen comment earlier, because bulking up that vaginal wall helps to hold the prolapses back. I really like pessaries. Pessary is kind of like an orthotic for your vagina. So if you notice your prolapse when you go on runs, so like if I was gonna go on a run and I needed some arch support, well, I put an arch support in my shoe and then I go on a run and then I take my arch support out. You do something similar with the pessary. You can insert the pessary, go on your run or your hike, and then take the pessary out. Most OBGYNs would say if you need the pessary now, you'll need it forever. I disagree. And really, if you want to support that tissue, especially like in like breastfeeding stages, like we might need a pessary just for while they're breastfeeding or until estrogen changes and then you don't need it anymore. But Kegels, pelvic floor contractions, figuring out why the prolapse. Sometimes there's like a perineal scar from tearing during birth and we need to work on the scar tissue so that the muscle can work better. I also brought some of my fun stuff. Every once in a while I meet somebody who needs a Kegel weight. Most people don't. But Kegel weights can be kind of helpful. There's this company that I appreciate, so I brought a pamphlet, but Kegel weights might help with prolapse if the problem is that you're actually weak, which isn't always the case, right? Sometimes it's because you're actually just too tight. And so for too tight, I have this, which it's like 25 bucks through this, well maybe 30, I think her price is went up. Through this company, but this you can insert into your vagina and then like massage out the muscles so that they can work better. So there's lots of options. Any other questions? Who has the time? I don't know what time it is. Am I going over? Oh, you're fine. Am I good? Forgot my phone.
Do you need it?
You got time?
What time is it?
It's 15:16.
2:17.
Ooh, okay.
You need this talk. Keep talking.
Yeah.
Okay, let's talk about, any more questions about the bladder? Okay. Pooping. Alright, so for pooping, it's just the same, it's the same muscles, just a different hole. And if a problem with fecal incontinence, this is like losing fecal matter. If you have diarrhea, it's just not there. So we don't judge ourselves if we have diarrhea and we're leaking, unless it's happening all the time, and then you need to go figure out why you're having diarrhea. So the pelvic floor muscles are a part of it. This is the rectum. So the rectum is the end part coming out. You also have the colon. So those are all pieces. The anorectal angle, I like talking about that because it helps us go to the bathroom. So the anorectal angle is the turn that the rectum, this is the rectum, as if it was sitting like this. This is the turn that it takes before everything comes out. So our bodies are always really smart. So don't ever think your body's failing you. It's not failing you. It's trying to communicate to you, and we have to figure out what it's trying to say. But the body is really smart, and so one of the ways that helps to maintain continence of fecal matter is when we're upright, or our hip angle is 90 degrees or less, the pelvic floor takes the rectum and slings it up. So that it's like this, and it's really hard to just leak fecal matter when it's like that. But when we sit down to go to the bathroom, our knee should come higher than our hip. And when it does that, our pelvic floor lets our rectum come down like this. So when we think about kids and the toilets that they sit on, they're set up just to become constipated because their little feet dangle, they don't have that right angle. So if you have little kids, try and make it so that their feet can come up so they're in a squat. And as we get older too, like, and especially in America, we love our really tall toilets, but it sets us up for having to push bowel out because of that angling. There's a thing that I like called the squatty potty, so I don't know if anybody's heard about that before. Yeah, I like the squatty potty. It's like $20 on Amazon. You can push it out of the way, so it just goes under your toilet. You can pull it back out when you're done. If you don't, or push it under when you're done, pull it out when you're ready for it. If you don't want that, you can just use a trash can or a step stool to put your feet up on. So, and the trick is just getting your knee above your hip. Because we have kids here, I want to talk about that, so I'm going to deviate just for a second. So with kids, nighttime bedwetting is often related to constipation. So when I see a kid who's still bedwetting or having a problem with that, it's the first thing we address is constipation. So if kids are having to go to the bathroom, hey, do you want this? Can you look at it? If kids are having to go to the bathroom and their feet are dangling and not well supported, they end up packing fecal matter up into their rectum, and then it just expands. And so we don't realize that they're constipated because they're still having bowel movements past where it's packing. And so that just gets stuck in there. And that'll eventually push on the bladder. And then that pushing on the bladder will push urine out, especially at night. And it's true for adults too. Sometimes adult bedwetting at night is from this fecal matter packing. So it's just really important to have a good diet for kids and then also get their feet up. Yeah. Well, yeah, that's a good question. I mean, research says like 7 years-ish. And a lot of it's because it's actually a hormonal piece. So if they're just delayed in that hormone, it'll take a little longer. I'm sure it's not because of constipation, because they might be continent at 2.5, 3, but because they're constipated, they're still leaking at night. So just make sure you tease it out as a parent. Yeah. And it'll fool you because they'll still be going to the bathroom. And adults too, like they'll say, oh, I wet at night, and I'm like, well, are you constipated? And they'll say, no, I'm not. I have a bowel movement every 3 days. And it's really just because it's like pushing past where it's packed. Bronwyn, how much rotting fecal matter do people on average have in their digestive tract? Do you remember?
This is a good question, I don't.
It's like a couple pounds.
It's a lot.
It's really gross, I know. So don't be that person.
But you should poop every day.
Yeah, that's
You
why
have to poop every day.
you like how I threw that out.
Every day you have to poop. Let's repeat that.
Yeah. So normal, let's talk about normal. So normal bowel behavior, it takes 24 hours to 72 hours for digestion. We'll talk about the sampling response in a second. I think that's the coolest thing about the rectum. A person can suppress that reflex to go to the bathroom, but you shouldn't suppress it for more than 30 minutes because then your brain will turn off that reflex and you won't feel like you need to go to the bathroom for another day. So don't suppress it for more than 30 minutes. Technically, 1 to 3 times per day is what we're told, but I'm with Bronwyn on you need to go to the bathroom every day. You should go every day. Let's just not have rotting fecal matter stuck in our colons.
Because you just absorb it. And
Yeah. Yep. That's what I wrote, but up to 3 days can be considered normal, but I disagree. Okay, the sampling response, I just have to tell you guys about this because I think it's the coolest thing that the rectum does. We could all think of the coolest thing this body part does. So there's an internal sphincter and an external sphincter in your rectum, so that's what helps keep fecal matter in. And the sampling reflex You guys use this at your next party that you go to. The internal one will let like just a little bit of gas, diarrhea, fecal matter in between the two. And then your rectum actually has more taste buds than your tongue. And it will taste it and then tell your brain what it is. I know, right? It's the coolest thing that it does. And it tells your brain what it is. And so then that way you know, like, oh, that's gas. I can't let that out now. Or, oh, that's diarrhea. I should really probably go to the bathroom. Yeah. You guys are stunned. Any questions? Bronwyn?
So what happens when you can't tell the difference between the gas and the diarrhea?
Yeah, right. So that does happen, especially, especially for radiation and things like that. Yeah, so actually we work, do you really want to know the ins and outs of my job? Or?
Yeah, really.
Yeah, that's one of the things that we work on, and we can do it with like a balloon. We do some balloon training. So you insert, this is medically, by the way. Do not do this on your own. Use a balloon, and we can do like different fills of the balloon to help retrain this idea of the rectum being able to communicate how full it is. We can't really retrain the taste part of it. If that part is damaged, that part is damaged.
And how does it get damaged?
Yeah, usually it's radiation.
Besides radiation, what if it, like,
Yeah.
in a bad, like a challenging burp and tearing into the rectum or something?
Oh, right, yeah, if you have a whole fissure, true. Yes, I was gonna say radiation is usually what I see.
Okay.
But yeah, if you have a really traumatic birth that tears all the way into the rectum, beyond just the perineal tearing up into the rectum, that would be the fissure in the vaginal wall tearing through the rectal wall.
Or people who have fissures and have to have surgery, something like that. Okay.
Yeah, or, yeah. Okay, so not so great things for the rectum would be suppressing that urge. We talked about that. Chronic constipation, that can lead to the fecal packing, which we talked about. Dairy and gluten can be sensitive for some people. So not for everybody, of course. Every body is different. But dairy and gluten could both show up as increasing constipation or diarrhea. So it could go either way. Okay. Things that are good for the rectum: feed up for bowel movement, getting good fiber, consistency, abdominal mobility again, probiotics. There's 2 really good research probiotic strains for constipation, so I wrote those out for you. Questions? Yes?
I walked in for a weird time. The taste buds is above or below the rectum?
I love it. Usually when we have students, I was like, I have 2 things to tell you. And this is one of them, because people love this. It like blows your mind. It's in between, there's an internal sphincter and an external. So the external is like right out at the opening. And so the internal sphincter is like right in here somewhere. In here somewhere, so it's just in the space is where it is. So that's why you can tell if you had something spicy. Right?
But why do they call it that? It seems like there's a difference between liquid and air, like a part and solid. So it should be more consistent.
But it's all
Right, it's
pressure.
part of all of it.
But it's all pressure.
Depends on the pressure. Okay, let's talk about pain.
Okay.
So pain, I wrote the anatomy again, but pain, I see a lot for people who have pelvic pain, is the pelvic floor is really just too tight. And so doing pelvic floor contractions or Kegels are not the right answer. Teaching your Kegel muscle to let go is the right answer. That would be what we call an opposite Kegel or eccentric pelvic floor contraction. The way that we talk about it in pelvic floor PT is like blueberries. So the way to think about doing a Kegel appropriately, which 50% of the population does them incorrectly. So if you think about your vagina, or for men, your rectum, picking up a blueberry and pulling the blueberry in, and then putting the blueberry back down. That is a proper pelvic floor contraction. And we're not making jam, so don't squeeze it. You're just keeping the blueberry intact and pulling it up and putting it back down. So that is appropriately ahead of your kegel. So if you're having pain with intercourse, for women especially deep thrusting pain, it's usually because the penis is hitting the pelvic floor muscles, and that means that the pelvic floor is walking around with just a lot of tension, so we really got to work on putting that blueberry back down. For men, sometimes tight pelvic floor muscles can look like erectile dysfunction. First you want to make sure that there's no heart component, of course, but if the circulatory system is clear, then it has more to do with maybe the muscles are too tight, not allowing blood flow into the penis. So they would need to work on letting go of their pelvic floor too. One of my favorite muscles is this muscle in the pelvic floor, and it's called the obturator internus. It's actually not a pelvic floor muscle. It's a hip muscle, and it's responsible for rotating your hip or keeping your hip really stable when you stand on it. But the pelvic floor attaches to that. So if you have hip problems, or you recently had a hip surgery, this is where sometimes that can cause pelvic pain because of trauma with that muscle. There are so many nerves in the pelvic floor, and one of them we almost all know is just the sciatic nerve. Some people say they have sciatica. That's where that nerve is maybe causing pain down their leg. But the sciatic nerve has to come through here before it comes out right about here in the butt and then goes down the leg. So if the pelvic floor is tight, then that can make the flow of that nerve not great. So if you've ever been treated for sciatica and it didn't get better, it might be because part of it is coming from the pelvic floor. The other one is called the pudendal nerve, and the pudendal nerve is your pelvic nerve, and it comes out right below the sciatic nerve. So sometimes people who have sciatic nerve problems also have pudendal nerve problems. And when the pudendal nerve is struggling, it can look like constant itching, pain with intercourse, feeling like your vulva is on fire. For men and for women, if you're riding a bike and you've been sitting for a while and everything goes numb. For men, that can show up as an increase in possible testicular cancer by not having good blood flow because of sitting too long on bikes. So those are the nerves. Oh, tailbone mobility. So the tailbone is connected to the pelvic floor, and this I see a lot with birth injuries where women have pain with sitting, or classic tailbone pain is actually moving from sitting to standing, and you feel like everything is clenching, or you get back pain when you move from sitting to standing. So that's a problem with the tailbone not moving well. The pelvic floor is interesting because it likes to tell us that it hurts usually right here. So people will come in saying that they have low back pain, and they'll point to here, and that's actually not low back pain, that's pelvic girdle pain, and it can be a referral from the pelvic floor. Low back pain is actually here, pelvic girdle pain is more in your sacrum. Okay, so back to the hormone component. The back part of the vaginal opening, so back here, that part really loves estrogen. So when women have a decrease in estrogen from breastfeeding or perimenopausal, menopausal, they can have pain with intercourse right on insertion. And that, with breastfeeding, it will get better. And everybody's hormones are different, so it kind of depends on when that comes back, when your hormones start to change and come back to where they were. I like to think about it as like our body is really smart, and if you're breastfeeding, your body is like, please don't get pregnant again. And so it makes it a little bit uncomfortable so that you're not like, let's not get pregnant again. But we can do lots of things. If it hurts you, let's fix it. There's lots of things we can do, even if it's a hormonal shift. It may not go away until your hormones change, but we can still make it less. And then with menopause, perimenopause and menopause, it's again where estrogen is really important.
As a pelvic floor therapist, do you actually test women's hormones?
No, I don't test their hormones. I send them to somebody who does. And Bronwyn is really good at testing hormones. She's one of my favorites because she looks at, she asks a whole bunch of questions with it. She doesn't just test estrogen and progesterone and call it good. She wants to know when. Yeah. Okay, scar tissue, we talked a little bit about that already. So if you had any tearing during a vaginal birth, getting that scar tissue to move is really important. There's a few diagnoses that can come with pain. Endometriosis, interstitial cystitis, which is also called IC or also called painful bladder syndrome. PCOS, that's polycystic ovary syndrome. Any sort of post-op problem, dyspareunia, vulvodynia, lichen sclerosis. Even though these diagnoses can contribute to pain, like I don't help with the diagnosis, but I help with the pain part, and there's a lot of things that we can do to help life be better. Things that are not so good for pain, that's lack of movement or too much movement, high inflammatory foods, poor gut health, low in magnesium and iron, or stress. Things that are good for pain is just the right amount of movement. Compression socks are really helpful, especially if somebody is having pain and they have dysautonomia conditions or POTS. Compression socks are super important. Making sure they get enough water, low inflammatory foods, probiotics, yoga, meditation, physical therapy, chiropractors, massage therapists, acupuncturists, craniosacral therapists. I probably missed somebody. Hormones, those are all really important. Okay, that was a lot. Thanks for sticking through.
That was great.
So welcome to the 7th generation ERC by myself, Nathan Good, training officer of the Professional Fire Department. The reason I came up with this talk is we had a crisis in Crestone when the firefighters were locked out of the Baca fire station, and it was all political. And I was the last firefighter there after the collapse occurred. So I had to come up with a way to figure stuff out so I didn't feel it was a crisis that people were, it was severe, let's put it that way. So I started studying what could restore our fire department. And what happened was I came up with Oliver Kelly and the Grange movement after the Civil War. So the Civil War, it was a disaster, obviously, and the Grange movement was a farmers' alliance that came together. We got the mutual aid contract, the stripe down the center of the road was invented during that period. Rural mail service, lots of amazing things, and even insurance. So with that said, and then fused with permaculture, I'm like, this is really interesting. I went to a school called Greenbrier, and one of the founders was Scott Pitt, one of Bill Molson's teachers' awards. So we started this fusion project in 1974 in the woods. This came about through a huge, massive realization that children in institutions wasn't working. Children stuck in classrooms, sitting on their butts all day wasn't working. So the UT Sustainable Development professors got out of UT, went and started this class in the waves. So that's basically what this talk is going to be about, is a fusion between the 7th generation philosophy, permaculture. We're going to jump ahead a couple slides here to honor the fire service real fast. And the reason we're going to do that is that the National Wildfire Coordinating Group is what led me to my modern education. So starting with that early alternative education, moving into the permaculture education, and then later into the 7th generation philosophy that I had to figure out how to restore our collapsed fire department. So we were able to do that through the Grange and all these methods. But anyway, I want to give a little bit of a thanks to the women here.
I think that without that, we just, men need to honor the women here. So I'm going to give a big shout out to Alicia for having this health fair and all the women who are putting their heart and soul into this. So thank you, everybody, for coming. Ow! Okay, so we won't go back to the generation of firefighters here for a little bit. Firefighters are cool, but these 7G folks came up with their philosophy is that decisions we make today, we should consider the effects of the seventh generation. So that's really the heart of the talk. It's the 7G ERC. Why do we need an ERC? An emergency restoration coalition has a potential to bring us out of a catastrophic situation. And this has been going on for years. Every person has an apocalypse in their life, whether it's a house fire or a serious childhood event that just leads to trauma in your entire life. How do we get out of that? We have to get out of it through methods, in my opinion. And those methods start with forgiveness. And I think that the seventh generation Iroquois people, they're still there, by the way. At the end of the slides here, the information will be available so you can go to the people of the Longhouse site. They started in the northeast, but all their tribes go from basically New York all the way to Wisconsin and north. So these indigenous peoples are still here, and that's the inspiration of this talk. Permaculture, earth care, people care, fair share, obviously very important. If we don't have ethics, how do we move forward? You have to have a heart of ethics, in my opinion, to choose this restorative method. And if we don't choose it, we're probably in our, reptilian brain? Does anybody know what happens if you're stuck in your reptilian brain? Owen! Might go crazy? Okay. So that reptilian, the basic, it's basically a freeze brain. You get frozen. You can't make decisions. All you know how to do is eat and kill, and you freeze up when it comes to cognition, right? So the part of the brain that most people are familiar with is the limbic, it's the fight or flight, right? It's like, oh, I gotta get out of here, this danger's coming, right? That limbic brain. And then also, well, no, they're coming to get me, I better fight them, right? So fight or flight's that midbrain, the limbic. The part of the brain that we're going to be using today is that cortex, that frontal cortex. It's the thought process. It's what's going to help you become a solutionary, right? And if you can't do that, you're not going to understand much of anything I'm talking about today. So we're not going to cover all the permaculture design principles, but they're there. It's a system. Basically, we're going to be talking about systems today. Again, the National Wildfire Coordinating Group, the CIA uses these tactics for their strategies. So this is huge. All right, so this is where we get the audience involved. Because everyone has a different idea of an emergency, right? And a crisis. Owen, tell me, what is a crisis for you? What's an emergency to you? Don't know? You're almost 8 years old. Do you have an emergency that happens to you in life? No? Okay. Anyone would like to share what an emergency to them is? Have you had an emergency lately? Fire, okay, great. That is the #1 emergency. It is a broader scale emergency that we might have in the Vaca Grande. And that's why I'm a firefighter, because I care. If there's a #1 thing that DHS is going to look at in the Crestone area, it's fire, all right? #2 is flood. But what we're going to do here now is we're about to cut right to the chase. Does anyone know how many fires are human-caused? By chance, a guess?
50%.
50%. It's 80%. 80% of all fires, and that's, again, back to statistics. Are we going to stand on those? No, but we're going to use them as a guideline. Okay, that's a guideline. All right, so in this slide you can see this is a FEMA wheel. They talk about project planning. All right, I have a wheel that we're going to bring over here. And the wheel that we're going to bring up in a minute is the wheel I created, which is the fusion of these methodologies. But this one is project planning, mapping, preliminary issuance, assessment, effective issuance, and mitigation planning. So it is a good wheel, and I like it because they have community outreach, education, and risk communication. In the middle is sustainability. I like that. That's a pretty cool wheel for FEMA. But for you, Does anybody want to share what a crisis is to them? What's the most important life threat? We call it IDLH. Does anyone know what that acronym is? Immediate danger to life and health. Okay? So let's look at the actual CDC of what IDLH is in the world. Okay? And then we'll talk about how those are caused. You ready? Okay. Holy mackerel. What is that? Like heart disease, cancer, and then they call it accidental death. Does anybody know what accidental death is? If you Google it, say again. Medical system. It's medical malpractice. It's accidents. Typically, 250,000 fatalities a year are caused accidentally by our own. Okay? And when you think about that, it's like, holy, wow, that's just, we did that accidentally. We're not trying to do it. I don't think so. Maybe corporations are trying to sell drugs or something. But it's usually misdiagnosing, given the wrong drugs, and then also surgeries that they cut out the wrong part, right? That's a big problem. The Johns Hopkins University actually estimated that 250,000 people every year, and this is 2022 data. All right, now if you look in here, the top 10, there's no fire, is there? Some firefighter talking about CDC stuff in here. You get into fire casualty, it's less than air traffic, I believe. It's pretty low. It might be somewhere in there, but my point that I'm making here is that all these are human-caused preventable deaths. Some of them may be what they would call hereditary, but that's been ruled out a lot. Like most of this stuff is environmental exposure, but a lot of it is our intake, right? And that's why the beginning of this talk, I'm going to just set this down for 1 second and grab this wheel here. My cheat sheet, right? The reason I came up with this is because acronyms are boring, but I love visuals. Cheat sheets that can be looked at and brought right up in here. So anyway, we're talking about the accidents, unintentional injuries, but if you look at it, it's pretty much all medical malpractice, which is sad. So then you get down to all these other ones. Every one of these is from something in the environment, most likely, that we're going to cover a little bit later. So the solutions to all this bad news is you can plan ahead of time. And you can plan your food, your family, and your safety all with some cheat sheets, basically, ideas that it's out there. It's all available, but you need inspiration, right? Otherwise, why would you want to do it? Otherwise, we're just back to this cycle of misery. And so usually now in Asian culture, especially China, emergency also means opportunity, right? So when you look at incident, what is the incident? Is it IDLH or are we in unhappy space? The idea of the incident here could be anything. We'll use COVID for example. For me, it was a great catalyst, an opportunity for me to rethink everything, right? So we have these car wrecks, fires, and big emergencies, the crises, right? And it gives you an opportunity to retune, right? So in the fire service, we do a lot of this assessing the situation. We prioritize our actions and we neutralize the hazards. We've got to get rid of these things that are in our way, right? So how do we do that? We have to study. So really this boils down to why would you want to study? You have to be inspired to want to. What happens? The catalyst, the incident, right? So I have been, for whatever reason, inspired by these catastrophic crises. Maybe it's in my DNA, I don't know, maybe it's just because I got tired of being a victim, right? The hero, victim, villain mentality, it's no fun. So I got in here, and how do we deal with this? Well, if you're going to plan, you might have to get education. If you're going to respond, you may need to communicate, right? So we're working our way down these slides. So we're going to go ahead and pump up the slide here, this next one here. The education, knowledge guided by wisdom is vital. I mean, if you don't have the fusion, you got all this knowledge, look at where we're at. Great knowledge, look at all these beautiful inventions, but are they being used in a healthy way? No. That's why the 7G method is important. That's why permaculture is important. The 7G guys say, think about your actions before you implement them, right? And in permaculture, we have the term, it's use appropriate technology. So that's the reason we're doing this. We're doing this because we want to study and approach situations, a whole systems analysis. We have a decision point. Is this action, non-action helping or hurting our collective health and our seventh generation future for the kids? We want to honor our parents. I want to honor my grandparents. I don't want to stand on their shoulders and then them looking up at me and saying, what are you doing? You're on my shoulders. Shouldn't you be evolving? Like, yes, thank you. I'm doing my best. Okay. So we're going to work through this pretty quick because we want to get to some interaction stuff. Food. Consume when available healthy substances and media. So many people right now just brainless on my son. I give him 15 minutes. He chooses something. I say, well, it could be brain rot, but then you need to have consumption of something healthy for a while. He knows the difference because I want him to know what a pitfall is. If you get rid of all the pitfalls, it's like these playgrounds you can't get hurt on, right? You're in a bubble, the boy in a bubble, you can't get hurt. No, you need to get sick. You need to have an incident so that you can grow and evolve, right? But then you need to assess, prioritize, and neutralize those ideal situations, especially if they're some of those big ones that are just destroying us. And you need to communicate that stuff. So that's kind of where this talk goes, all right? Now, what did it, during COVID, what happened? What did they say? Stay inside. Well, what? How do you get D3? How do you get sunshine? So there was a lot of misinformation, problems with communication, because we had the incident, and we're assessing the situation. We're like, yeah, there's a problem out there, but what they're telling us is not really healthy. So we had to use critical thinking, right? And so that's where this is. You want to bathe in that, breathe with nature and the divine. You want to dig down to perhaps something that's not visual. And when people ask me, so what's the most important thing to take in, food-wise, and then how do you get there? It's a psychological dance. They say, and according to the CIA and the FBI and FEMA, only 16% of the population is going to be able to think carefully during the incident, because you're going to freeze up with your reptilian brain, right? So you have to grow out of that, pass the fight or flight into the cortex, into that frontal brain area where you can get into the nuts and bolts of having to take healthy actions, right? So that's what we're going to do. So we're going to ask a little bit of that gut, that sixth sense, if you need some help, right? And that's where Christopher comes in. Christo, Buddha, your inner guide. For me, my mom told me, trust in nature. That's why I use the seventh generation philosophy, permaculture. I'm using spirit and science, both, okay? And again, you need to rest well, all right? So we're going to move on here. This is the important one. The safety, family, food, family, and safety. Obviously, man, if we don't get our family straight, this could be serious because we have a situation where we're fighting each other. And if you can't have peace in your own gut, so if you're eating GMO foods and half of your intestine and gut is fighting each other, you're not going to have a very good time with dealing with your own brain or your other family members. So it's really important to have a clean, healthy diet so you can have a family, because the first family you got is yourself, your psychological balance. If you can't be balanced in your brain, you're not going to be balanced in your gut, because you're going to eat shit, excuse me the language, Owen, and you're going to have bad relations with the rest of your world. So deep connections and relations of your communities to build that local and regional human, plant, and animal community to produce food and guilds, stir traditional ecological knowledge and local wisdom paired with perfect technology, and create coalition to gather in times of need, right? Some people don't think there's any problem right now. Is there anyone in the room who thinks there's no issue in the world right now? No issue? We're at peace.
Everything's just the way it should.
Exactly. Thank you, Anton. And the reason that is that we're supposed to have the incident. We're supposed to have the challenge. If you don't have an incident or a challenge, you're going to be peaches and cream all the time. You're not going to have any resistance to grow and evolve. That's why I believe we have situations. We get hurt. We have problems with our Skene's gland. I can't pee. The male prostate doesn't work, and you got to figure it out. You need to have some healthy fats, yeah. You need to exercise, yeah. So we got to do this stuff. Otherwise, it's not going to work anymore. All right, safety, situational awareness. Does anybody not do that? You watch where you're walking, right? Everybody's got to walk. But you got to prioritize your self-care. Otherwise, again, how can you work with everybody else? As a firefighter, if I come into the station, I can't even function very good, how am I going to help with the team and drive a fire truck and be an engineer? I got to run the pump, right? But I'm a training officer, so I really enjoy this kind of stuff because I don't want to just be stuck on the pump. So I've got to do some kind of leadership rotation, and that means taking a break from monotonous everyday running the pump jobs to actual training and studying and things like this. And then you're going to share that system, you're going to share the leadership responsibilities and inspiration so that other people can step up. Because one incident commander can't be on the job all the time. You got to train others, and that's why we have children. That's why we have these conferences, right? These health fairs. So if I'm not doing good, I need a lookout in the fire service license, lookouts, communications, escape routes, and safety zones, because we need to have a system in order to deal with the incident if it occurs. It doesn't mean we're going to remove every single nail or whatever. It means we got to get out of that space. That's my my alarm timer for letting me know. Okay, so communication, we covered that a little bit. We have to be in a trusted space. If we can't trust our communicator, then we're going to doubt the message, right? So there's subjective and objective. If you see it with your own eyes, you can kind of trust it. But if you can't trust it, then you're probably not going to take action. So that's what's happened. They flooded the world with fake news. Hardly anyone can trust anything, so guess what? They're complacent. They don't care anymore, and so they're just running away with it. We got to document this stuff in case we need it again later. We're going to fly through these a little bit. Assess the situation, prioritize the actions. Those are all, once we get a strategy, we have to have tactics in place. And then we're going to get into the neutralizing the hazards, which is to, if you got a bone sticking out your leg, you got to deal with that, right? You got a building on fire, you got to deal with that. You stabilize the incident. And then we're going to evaluate the needs. Or is there any more? Are there people on this team who need rehab? Is there anybody in this room who needs help right now? Sounds pretty good. I think we're doing all right. All right, so once we do that, we're going to overhaul. We're going to just double check everything. We're going to make certain, as best as possible, that we have all those needs met. Are there any cracks that we missed? And that's really going over with a fine-tooth comb. I call it, it's a type of relationship triage. And they do it in crisis mediation and stuff where if somebody's not having a good day, are you okay? Let's double check everybody. Because if we let somebody through the cracks, we're going to feel bad about that later. No one likes it when we leave an ember to burn later and it burns the house down after we just saved it. So you got to double check all that stuff. And then you're going to restore it in a holistic manner, all right? So the debriefing is afterward we go home, we go to the station, we go to the food hub, and we talk about how we do. We do all right? We need to adjust things for later, document it. All right, we're flying through this stuff. All right, Unknown Health Jobs is ready to cover it pretty quick. Does anybody know what happened to iodine? One of the reasons all those ailments are coming up is because we displaced it with bromine, with chlorine, with fluoride. So up until they started adding all this stuff, we got iodine. And the general population in the 1970s was about 2.6% iodine deficient. But guess how much we're deficient now? We're like in 59% deficient in iodine. If you don't have enough iodine, you start dying. Iodine. Okay, so there's correlations here. We've got to get it. And that is an unknown hazard. It's kelp. Hello, people by the beach in California, they're healthy because they eat foods, they're breathing the sea air. Literally, you look at this next slide, you're going to be like, oh, those people are healthy because they live by the beach and the sea air is blowing in. But if you eat enough of the bromine, chlorine, fluoride, it displaces the iodine, just like carbon monoxide displaces oxygen for your hemoglobin, right? So you can't get oxygen if you have carbon monoxide particles in your blood, because it attaches so easily to your blood, unlike oxygen, right? So it's the same stuff with that. So all these hazards, prostate, the Skene's gland of the woman included, just gut cancer, breast cancer, all of it, and psychological. You'll go nuts. You'll literally freak out if you don't get enough ID. Okay, so here's this next slide. This is the great news. The great news is Colorado. People live over 20 years longer than average. Look at that. So the deep purple in there, that's you're living a long time. You're living a long time. 87 years average. Look at Colorado is the only state that has the deep purple, except, yeah, look at that. Congratulations, you live in the healthiest state in the union. Isn't that awesome? But look at the seaboard over there in California. Everybody's healthy because they got the iodine coming off the beach, right? And in other places, but where you see a lot of red, that's you don't live very long. That's an ideal place to live. Don't go live there. I recommend living somewhere else. So anyway, I thought this was nice to end on kind of a nice note that that's a great study, right? That Colorado, like I didn't know that, right? Because when I built this presentation, this is my first time ever doing this particular presentation, by the way. So thank you for coming. And then I'll give one more thanks for honors here. So this slide is for people to take notes if they want to go to the 7th generation, the tribe, the Iroquois people in Longhouse. That's their website right there. And they have a headquarters in Canada. The 6 nations are still alive and well, and you can get the 7G way right off their website, right? They have a governance system. They don't mind anybody taking their system. And guess what, everybody? This U.S. Constitution was inspired by the 7th generation philosophy. So Hiawatha and all these people who were part of that met with Ben Franklin and George Washington to draft the United States Constitution. And it's basically a do no harm, free, live and let live place. So all this stuff they're telling you have to do, it's bullshit. Excuse the language, but you don't have to do that. And Michael here knows the truth because what do you call that when you're sojourning? You're free man, you have inalienable rights, you don't answer to anyone but you and the higher divine, right? Sovereign. No, we don't like that word anymore. It may be, technically it's foreign national. But anyway, yeah, if anybody wants information on this, I do have trifolds. I'm going to leave them out. Say that again, Andre. Non-resident alien, yeah, foreign national, they say. You can actually fill out the paperwork for that on a, what do you call that? Passport. When you go get your passport, there's a box to check for foreign national. And a lot of people coming over the borders are checking the foreign national box, and you gotta, maybe some credentials, ID, paperwork, stuff like that. But anyway, I want to offer you guys, anyone who wants a pamphlet, these are the cheat sheets. I printed these up because I want people to know that it's an open source. Until somebody offers me $1 million to come do this somewhere else, I'm going to offer it for free. And then after I get the big money offer, then you'll have to buy it. But until then, it's free. But anyway, thank you guys very much for coming, and it's been my pleasure. Blessings.
I just want to shout out to some of our amazing sponsors and to all you amazing people who have been here to support this day and trying to bring awareness and resources to the Valley on health and wellness. So I really want to thank the Dune Valley Distillery for having this amazing event space for us to come and gather in all the ways that we're trying to bring community together. So thank you to Nick and Dune Valley Distillery. And I'd also like to thank Refined Form Physical Therapy. Jen has an amazing offering coming from Crestone. She's got her information over here, so take a moment and go talk to Jen about physical therapy and her amazing business, Refined Form. We also have Ann Krogan, who spoke with us before, the Salida Pelvic PT. Such a wealth of offerings with her. She does home visits and works with the Harbor Rockies. Alpine Valley Mushrooms, a local favorite. given us such good medicinal and edible mushrooms that they grow with so much love. Aviva Apothecary, that's my personal business. I do local tinctures. I also do some sitz bath, pregnancy tea, locally grown herbs and products. There is some sitz bath and pregnancy tea available. We've got Mother's Circle, Katie Daniels Milligan, and she'll be presenting after me with a Mother's Circle. We also have Grades of Becoming with Mimi and Jess Foreman. They are creating a program of rite of passage retreats for young girls, helping them into the phases of life and supporting them. We also have Nathan Good, who presented with the 7G philosophy, and Shangri-La Stove. He's been doing business in the area for so many years. Salida Dermatology with Sheree, and she gave us our talk on skin cancer and skin care. And Bronwyn Radcliffe, of course, with the Colorado Center for Lifestyle Medicine, doing her work in the world with resilience. And she does have some upcoming workshops coming in Salida, so if you want to know more info, check in with Bronwyn. And I am with Ancient Arts Midwifery. I've been a home birth midwife in the area for about 20 years. And to start it off, I just want to kind of show us a video of a birth. And maybe or maybe not, you've seen a baby born. Maybe or maybe not. Most of the things that we've learned about birth usually have to do with a very stressful, super medical, emergency situation. And it is so not that way. Birth is one of the most natural processes. There are over 7 billion of us. We have been having birth at home, safely, with midwives, sisters, mothers, for 100,000 generations. Let me just repeat that. 100,000 generations of humans have been born safely at home before we've had hospitals, and I'm so grateful to hospitals, because we do need hospitals to help in situations that are emergent, and yet we've only had hospitals for 100 years. 100 years, and how long have humans been alive? A little longer than 100 years, so, you know, you do mental math. But anyway, so I just want to normalize seeing a birth. And this movie is one of my favorites. It's called Birth in the Squatting Position, and it is based in Brazil. Most of these women do a lot of work squatting. Most women are doing a lot of gardening. They're doing a lot of chopping. They're living in and on the earth. So, you know, our culture where we sit back on the couch and, you know, we watch TV, maybe we're sitting in chairs, we're leaning in these different ways. You know, we're set up in a different way with our culture now. So just to remind us that being in a squatting position, doing things in a squatting position, as much as you squat, I've even heard that's more beneficial than Kegel. So, you know, everybody can do it for you, right, when we think about it. But let's just take a moment, we'll watch this, and I want to just warn anyone that does have any trauma around birth. You know, there is going to be some nudity. There will be an actual birth that we see. So prepare yourself. And without any more build up on that, we'll just go for it. You know, we're going to get some watermelon.
Space bar, Alicia?
In this position, you give birth. In our own work, we couldn't find enough
So, two really beautiful, very gentle births there. One thing I've really noticed about this video is that when the women have their baby, nobody's really even touching them. Nobody's touching the baby that much even, and the baby just comes right out. And then the mom kind of says, whew, wow. And then she kind of touches her baby, she meets her baby, and it takes a little bit, you know? Each mom there, it takes a moment, and then she picks up her baby and takes a look at the baby. So I just kind of want to ask if anybody has any feelings about that before we move on. It's kind of a lot to witness. And I just really like the gentle effect of this bird. There is another one I want us to see. We'll just keep going a little bit if everybody's doing okay. All right? The baby's hand is up in this birth. I'm just taking a moment to see my baby. The baby's breathing. Baby's pink. Mama's just saying hi. And so she's asking, why is there blood on its arm? And it's because there is blood that feeds the baby the whole time the baby's growing. And when the baby's born, sometimes there's some blood that comes out too, but it's normal. And there's the baby crying. And that's the placenta. I'm gonna pause it there. Look at that cute little baby. Wish we had a little, let's go to the baby space. All right, sweet baby nursing there. So just really nice to be imprinted with a natural birth. I think we see a lot of very intense imagery when it comes to birth. And I feel like a lot of the words that we use around birth, a lot of the things that we see that are related to birth are very, very impactful on us when we're impressed with that. So, you know, does anybody have any thoughts or questions after seeing that? I just love this movie because, you know, it shows that all of that intervention, all of the things that sometimes seem like they're linked to birth don't really have to be there. And, you know, my talk was Meet the Midwives. I was hoping I'd have a few other midwives joining me. There are some midwives in the audience here, so I just want to take a moment and recognize Barb Simonson. She was my midwife and helped me have my baby in Crestone 22 years ago in the teepee, and we had a pretty similar thing. I think I was in hands and knees, but you know, no running water, no electricity when I gave birth to my kids. And then Annalie, she's a student midwife joining us, and Annalie's been apprenticing and working with myself and Nimini, another midwife in Del Norte, for quite a few years now. And Mimi, working with birth as well. Mimi and I have worked together on a few births, and she is a powerhouse of birth wisdom. So, you know, good to see all these powerful birth workers and mamas in the audience. You know, just sending out love to all you ladies and gentlemen here today. So, you know, I got into midwifery because I was very passionate about survival skills at the time. I liked tanning hides, I liked learning how to make jam, I wanted to know how to grow my own food and how to even make my own fuel and how to live as a human without having impact on the earth and how to be self-reliant and how to really take steps so that we can survive when the collapse of society occurs, right? So, you know, I was kind of on that path myself, and then I was studying to be an engineer. I wanted to build, and I realized when I got pregnant that I was building the most incredible creation that was ever possible to create. And it didn't take an engineer to design it. It just happened and I didn't even think about it, right? You don't think about when you're breathing, you don't think about when your heart's beating, it just happens. And that's the miracle of childbirth and even growing a baby, that cell by cell, this miracle occurs without even really doing much besides eating and drinking well, and of course, you know, I could go into specifics, but the reality is humans are resilient and we are made to survive. Childbirth is meant to happen if there's no one there, because for many, many generations there wasn't anyone there. So we learned a lot over the years, you know, how to protect ourselves. People do have ways to work through emergencies. I like to work with herbs mostly, but anyway, giving birth to my kids in the teepee really taught me that if there is a survival skill to know, this is probably the most important one, because the survival of our species is very, very linked to love and creation and continuing to bring in these children that are so strong, so powerful, so curious. You know, I love this little one just watching like, what is that? Is that a baby? She said, yeah. Wow, is that the head? Is that blood? Yeah, that's okay, it's good, it's good. You know, just how normal it really is. It's really important. So, I do have some visual aids over here. Of course, a mama and a baby growing healthy in her belly. There's some books here. I feel like the power of story is really key. So if I had all day to talk, I'd like to go around and we can all share our birth story, or a story of when we gave birth, or the story of when we were born, because everyone in this room has a birth story, even if you haven't given birth yourself. So, just in this context of life, having compassion for one another, I feel that that's a really important part, that we all remember that we have been born for a reason. And as Bronwyn said, we're also going to die for a reason. So while we're here, let's do what we can do to lift each other up, to love each other, to support each other. And I could go on and on about birth, but I do feel like I would like to hand it over to the mother circle here. And if you'd like to speak with me more about home birth, or the safety of birth, or any questions about midwifery in the Valley. And here, I've got a baby set up over here if you want to weigh your baby, or you want to have your blood pressure checked, or if you want to have a beautiful hug, or if you would like some pregnancy tea, come talk to me. And many blessings. Thank you all for being here today. We can just finish the rest of the movie if anybody wants to watch that. Okay, I'm going to hand it over. I did have a song that I did want to sing before I close this. Trust in the dance, the trance of birth, grandmother of time, ancestral earth. Blessed baby is born, singing along with the rhythm of the womb's eternal birth song. Trust in the dance, the trance of birth, grandmother of time, ancestral earth. Blessed baby is born, singing along with the rhythm of the womb's eternal birth song. From the beginning of time, with the first living seed, Mother Earth gave birth like we give birth. Trust in the dance, the trance of birth, grandmother of time, ancestral earth. Blessed baby is born, singing along with the rhythm of the womb's eternal birth song. Oh, thank you so much. Okay, so first I just want to give a big thanks to you all for being here and being in our circle and attending this wonderful wellness event. It's been such a wealth of local knowledge and local people here, and it really brings the community together. So I'm just going to give you a little background on myself and my practice. I'm Katie Elizabeth. I live over in Crestone with my husband Marcus and our 3 kids, where we're building an earth bag house. As a young adult, I did a lot of traveling to various eco-villages, Dancing Rabbit Eco-Village in Missouri, and Oroville in India, Fintorn Eco-Village in Scotland, and various communities in Kenya and Nepal. And all of these places are really embodying a community mindset. They're growing food together, they're raising their kids together, and it just really inspired me. And then I went on to study permaculture at Punpun Eco Village in Thailand. And more recently, I was an assistant for a functional medicine practitioner named Dwayne Law in LA County. And he really inspired me to go on and get my health coach certificate. And as a mother of 3 myself, who has embraced the off-grid lifestyle and
Also a former athlete, I really realized the need for healthy rituals in motherhood, especially when you're experiencing stress and anxiety. And also through my travels and my lifestyle, I really discovered that our culture is increasingly disconnected and just the need of support for mothers. And so I believe that the time has never been more important to come together and essentially support and strengthen our communities. So today I want to celebrate a journey that is as old as time, and that is, like Lisa just said, the journey of motherhood. It's a path of love, sacrifice, joy, and challenges, but it's profoundly enriched by the power of community. In ancient tribal societies, motherhood was celebrated as a communal experience. The village was deeply intertwined in the nurturing of children. It was not just the responsibility of a single mother, rather it was a shared duty among all the members of the tribe. Women would gather, share wisdom, eat together, provide guidance, and support one another in the sacred task of raising the next generation. Obviously, these tribes also lived a lot closer to nature than we do today. So I want you to imagine for a minute the collective joy of children in the tribe growing up together, the support that all the women and men felt from exchanging ideas, hardships, and life experiences. In modern times, we might not have the same structures, but the essence of that communal importance remains. Community is just as crucial as it was in ancient times, whether it's a neighbor dropping off a meal, or a friend offering to watch the kids for an hour, or a family member lending a listening ear. It shows us that motherhood is not just an individual journey, but it's a collective one. We're reestablishing our connection to Earth, also goes hand in hand with those acts of kindness. Let's also not forget the beauty of diversity in our communities. Every mother brings a unique story, background, and perspective, and embracing those differences really opens us to new ideas, new experiences, and it really enriches our understanding of motherhood. When we come together as a community, we can also drive change and advocate for each other and our needs. So in conclusion, let us cherish community surrounding motherhood and fatherhood and families and everyone, children, and nurture and advocate and celebrate it. We can create community where every mother feels supported, every father feels supported, empowered, and connected. And I just want to remind everyone that it really does take a village, and I believe that we can create that village when we all come together. So this is why I created my business, Ritual Mom. I'm a certified health coach, and I help mothers just refine their healthy balance through sharing knowledge and routine. I believe that we can really show up for our communities and our children and our partners better. And then I also host local mother circles with Mimi at the Earthworm Forest School, and it's been really great so far. So come anytime, it's the second Sunday of each month. And now I just want to do a little activity so that we can all kind of feel in the community. I want to start a little discussion, and if you can go in a circle and just share a time that your community brought you joy, support, or inspiration, or share a vision that you might have of community. Let's start.
Well, I think we should have a community space like this in Crystal. Here. Yeah, so we can all get together and dance and celebrate and have a big public that's not dependent on
the big infrastructure of like charter school, the POA, it should be hours. And this is making it easier, but we're not having to pay big money a year out.
Yeah, I agree. Would you like to go next?
I've been in Crestone for 8 years this year and have been involved in a lot of projects that sound good and then they don't go anywhere and then we're this big dance. So I've seen this, there's a lot of seeds that have been planting and now they're getting ready to sprout. And so one thing that I keep seeing over and over and over, and I've heard over the years, because there's so many single mothers, is a mommy village. And I would love to sit with you sometime about your experiences in all the places you went to. But yeah, the mommy village. And whether it be for single mommies or not,
I love that.
a community that mommies can support each other. But sometimes mommies need some time off, and I've seen that so much. I babysit a lot for different sisters.
Oh, really?
I love children. But yeah, a mommy village is something I'd really love to see in this community.
I like that
You know?
idea. Did you want to share?
I like discussing community stuff over coffee in the morning.
Nice. I know, I see it at the cloud all the time. That's true.
Me, community means showing up and being there, and it's yeah, a bit of a commitment to engage in community.
Yeah, I agree.
I've had some great experiences already with a few mother circles, and I think it's a really powerful vision to just continue to show up for and see how big it grows.
Totally.
To have more faces that I recognize versus not, it just feels like
The San Luis Valley is a very special place in the sense when there are events like this, kids are watching a great game with your mom, and any that feels like home and like safety and community for sure.
I think the more powerful community support things I've seen was about a year ago. We were involved in a home process for a friend of ours who was terminally ill with cancer and went through the medically assisted diet process. And it was like my wife and a couple of other artists like painted his coffin box and my kid was like the whole like process and people showing up to help move the body and it was just a really beautiful like community process that we don't really well Preston is really different and also and the greater community is happening there.
For sure.
Can I say something just on that note? I was a photographer for a lot of years, and I did bereavement photography when people lost a child. And I was in Alaska, so there was a lot of fertility rates with alcoholism and things, and that is so important. What you get to witness and experience, the painting of the coffin box, and so that's thank you for sharing that. That's the hard side of all this, you know.
Did you want to share?
So her birth did not go as planned. It happened very early, and when that happened, our friends and our neighbors and the community showed up and they made sure we were fed, they made sure we had the money that we needed, they made sure that everything we needed was taken care of. And part of that, I'll get a photo of this Eagle Airhead, it was this insurance over here. That's real mutual aid. It's $100 a year, and it saves us over $100,000. The customer service was awesome. I don't even just talk about that, but that's part of the community too. This was a possibility, and it was a gift to us, this insurance. So,
Nice.
yeah.
Great. Yeah, big thing.
And I love just like sign up. Like, this is my Celia. shake each other, hug each other, and share circles, prayers, and storytelling. I just feel like we nourish each other, like just our passions and our hearts, reaching out, and wanting to step in more about like sharing more of what
Right.
and I want to say as well, a couple months ago, I went also with a great someone from a great being assisted, medical assisted living, and it really helped. It's such a powerful, it's very touching. So it's beautiful to see what you can all learn from the beginning.
I ran an education forum for women for about a year. One of the things that I really tried to promote was the idea of intergenerational relationships. I called them movements and encouraged people, men and women, to have someone in your life in every decade that you are devoted to. So have a teenager in their 20s, 30s, 40s. I had a person in their 90s. And then it's kind of simple and spontaneous. I remember one time I went over to a lady's house, she had 3 small children, and I brought a bubble bath for her. And in the middle of the day, she got to take a break and just go be herself. So it doesn't have to be a big thing. Might be a meal, might be a poem, might be whatever you think is a way to connect with that person. But it really, I think, strengthens the fabric of community when you have this
Absolutely. I love that, yeah, because like in some of these countries that I visited, people just live that way. There's the children and the mom and the dad and their parents and their parents, and they all just stay there together and kind of pass on the knowledge that way. So I absolutely agree with you. Does anyone else want to share a time that your community brought you joy, support, or inspiration, or a vision that you have for community? Yeah, go ahead.
Through like Hartford, at the work conference, I have like such beautiful relationships. A lot of them don't have health insurance, so they have major medical bills, all kinds of social and people have little babies, and it's younger women who are really to help them to after babies born.
Yeah.
And, childcare, food, all the housing. When we go and do postpartum, that's on Mondays, they're in bed.
Yeah.
And they're able to spend that with their family, just with their babies, cuddling and, kind of like a beautiful relationship. I wish I could see a little bit more of that in our community of women.
Totally.
I just wish that we functioned that way.
I feel you.
It just,
Deeply.
but I've seen that in, like, here in the valley, it doesn't affect us, but being able to watch that happen.
Yeah. Thank you for sharing. All right, well, I'll share my time. When my daughter was born at the Labyrinth in Crestone, Iseline brought me a pool. Cor brought me some food. Marcus was there to catch Brea, and there was 9 other people in the kitchen making us dinner. And she came so beautifully at 7 p.m. And then we had this feast of like 9 people in the house, just making sure I was okay and eating. And that, I think, is what really inspired me to do all this work, is that experience of community, and having a child, and everyone being there like that for each other. So I thought I would share that quickly. And yeah, so thank you all again for being here. Thank you, Alicia, for putting this on. It's really been amazing. I feel honored to have been part of it. And if any of you are interested in checking out my business, Ritual Mom, and it's also an app you can download, or group coaching, or collaborating, or joining, or hosting a space with me for a mother's circle, please go check out my booth. It's the little pink one right here. And if anyone wants to sign up for my email list, I will send you a free Mama's recipe book, and I think that's all I have to say.
So we're passing some sage around. Anybody who'd like to smudge? Just let go of anything that's not supposed to be here right now. I'm Andrea, and I'm very excited to be sharing some songs here today. And we have an altar here we're ushering in spring equinox, which is on Thursday. And so we've got Equal Day, Equal Night, and it's a really potent time of the year. And I'm super excited to sing with you. I have some songs we're going to be sharing and some instruments. So I'm really kind of like feeling the spirit of play, of playfulness. You know, remember being in music class when you were little and you get to pick up an instrument and play? Just have fun. Just have some fun. Because it's going to be great to have chances here to play this beautiful music. And what I always tell people is, even if you think you can't sing, everyone has a voice, right? And you are just one part of this beautiful creation story. And it just because maybe somebody told you that you didn't sing well when you were little, or they hushed you, it doesn't mean you can't sing and that you don't have a connection in that way. And so it's not about how you sound, it's how it feels, and it's a resonance, it's a connection. So, you know, when I think about wellness, I feel it's holistic. And so like in native traditions, there's a word in the Lakota tradition where the word is wichozani. So wichozani means it's health, it's healing. But that doesn't mean just like what you put in your body, it's how you live your life, you know. And what kind of thoughts? How are you to your neighbors? It's very holistic. So spirituality is part of being it's being conscious in this whole story. So I feel song is a way to connect with spirit and to connect with nature. And it's a beautiful thing that we can come together and use our voices. This is one of our great powers, being alive, being a human, that we can be this symphony, we can be together and express in that way. I always thought it would be really neat if we could stop talking so much and we could sing and dance more. You know, like what would life be like if we went to the grocery store and we sang songs together? I don't know, like the things that we do could be more of that. And you know, really the root of this gathering, when I spoke with Alicia around wellness, it is about bringing back, it's not about just the woman, but bringing back the qualities of the feminine. And that is the beauty and expression. And that's I believe, that's what's going to bring back balance to this earth, is more of us feeling free, emotional expression, you know, the arts, all of these things. And that's the healing of the earth, and that's the change that's so uncomfortable right now. And so in order to cope and to thrive, we have to just be in harmony, you know, be with our neighbors and connect. And so I had this real vision of us coming together, the valley, the whole valley, right? A lot of us, we come from different places. And so why not come together and sing? We all have voices, and we all share a lot. And all the people in this valley, we share this valley that was always known as the Bloodless Valley. And we see there's a lot of push, there's a lot of incentivizing of like, let's be separate from each other, but truly, this is a valley of peace. So we'll be singing some songs about that, about peace, and bringing in this renewal of spring and creativity and new beginnings.
from different traditions. So we actually have a buffalo sculpture hide right here, which I thought was really neat to share that. We're going to sing one song that's Native American, and that is honoring the buffalo from all the directions, which there's evidence of buffalo roaming this valley. I think it was like 13,000 years I was reading about, so long time. I'm going to pass around some instruments, and actually when we do the directional song, I'll just play the drum, and I have words, so you can see about singing along, and it might sound foreign to you if you're not used to the language, and that's okay. You can also just listen. That's fine too. Might need to share. There's like one share later. Yeah. To me, it's easier just to sing. I don't want to talk. So this first song, we're going to call it Direction Starting in the West. And Tatanka in the Lakota language is buffalo. Tatanka. So I'm going to go over just some of these words briefly. We won't go into too much detail, but the first word is towards the west. Wiokpeata. So you can repeat after me. Wiokpeata. Wiokpeata kia. And then we're going to go to the next line. Takuwakan. Takuwakan. Wa'uwelo. Wayankuyelo. So I think once we get singing, just let your voice do its thing. Don't think about it. I think we just start singing. See how it goes. I never did this before. So that's a song to honor the directions, and we actually were doing a closing circle, but I was taught it's always good to honor the directions. So this is the beginning of our ritual that we're doing, and ending this part of our wonderful gathering here today. So I want to thank you, Alicia, for pulling us together, making this happen too. Alicia and Nick, everybody being here, yeah. the first, it's the beginning, new beginnings. So, all right, we're gonna go to the next song, which I want to pass around some instruments. I want you guys to have fun. Pretend that you are in music class at school and you just don't care. You're a kid and you're just having a good time.
Yeah, my brother, he was passing through the stuff from New Mexico. Otherwise, we're going to be here.
Song number 2 is just really simple. It says, sing through my voice, play through my hands, let the way be open. That's all. That's it. So, we'll just start singing. Just have fun with it.
Oh, cool. That's good.
Play with your instruments and trade with your neighbor if you want. The song goes like this. We are created by sound. We are created by the song of the universe. We are created by sound. We are created by the song of the universe. Singing with the wind. Singing with the song of the universe. Singing with the trees. Singing with the honeybees. We are I have some different divine feminine beings that we can call upon. Persephone, which is who I have in the center here. We're going to call, these are all goddesses that, it's like bringing in the renewal of new beginnings, spring. Like I said before, creativity and beauty. So we've got Maria, Saraswati. So this one we need to practice the pronunciation of this one. Xochitl. Xochitl. And then the last one is Astara. So these are all from different traditions. And I have some flowers. They have seeds in them from last year. And I'm going to invite you all to take one of these and break it open and just at your leisure while we're singing this, go up to the altar and just sprinkle the seeds and just be thinking about what kind of seeds that you'd like to plant as we're moving into spring. So I'm going to pass around this basket. So you'll just take one of these flowers, and then you'll break it open, and then sprinkle the seeds on the altar here, and I'm going to scoop them up and take them home, and I'm going to scatter them on my land. There in Crestone. So just be thinking about, intending what you'd like to plant in your life. This is a really great opportunity. We're all feeling that. Times have been kind of tough, It's this balance between dark and light right now. And it's an opportunity to make some real changes in your life. But we need to do that with intentionality, We have to do that with purpose. So I'm just going to start singing, and you all just sing along when you feel like it. And whenever you want, you go to the altar and just sprinkle your seeds and just be intending what it is you want. The song goes like this. Did you run out of flowers? Shochiketsa, Shochiketsa, hey, hey, hum. Shochiketsa, 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 hey, hey, hum. Shochiketsa, 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 hey, hey, hum. Shochiketsa, 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 hey, hey, hum. Astara, 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 hey, hey, hum. All right, I want to hear y'all singing. Persephone, 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 hey, hey, hum. 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 Maria, 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 hey, hey, hum. Did everybody plant your seeds? We're going to sing song number 6. This is a song from the Sufi tradition, which is very beautiful. So when we say beloved, we mean the divine that's within everything and everyone. So sometimes it's hard to find that, you know, when we feel different than people or whatever, but you know what? We all are living here together on this planet, and there's always something we can find commonality in everybody. So the beloved. So the song goes like this. Drink the water down, tip the glass. Drink with the beloved. Take each breath like it's your last. Drink with the beloved. La ilaha illallah. La ilaha illallah. La ilaha illallah. La ilaha illallah. Drink the cup of loving down. This is truly drink and drown. What is lost, it shall be found. Drink with the beloved. La ilaha illallah. La ilaha illallah. La ilaha illallah. La ilaha illallah. Go to the east, go to the west. Drink with the beloved, you cannot escape this birth and death. Drink with the beloved, we're a caravan guys, is this a lot? I'm throwing a lot of words at you, right, at once? Okay, cool. Close. Let's sing it one more time. Drink the water down, tip the glass. Drink with the beloved. Take each breath like it's your last. Drink with the beloved. Drink the cup of floating down. This is truly drink and drown. What is lost, it shall be found. Drink with the beloved. La ilaha illallah. La ilaha illallah. La ilaha illallah. La ilaha illallah. Drink the cup of loving down. This is truly drinking down. What is lost, it shall be found. Drink with the beloved. La ilaha illallah. La ilaha illallah. La ilaha illallah. La ilaha illallah. Go to the east, go to the west. Drink with the beloved. You cannot escape this burden death. Drink with the beloved. La ilaha illallah. La ilaha illallah. La ilaha illallah. La ilaha illallah. We're a caravan, you see, moving towards our destiny. You must find the eyes to see. Drink with the beloved. La ilaha illallah. La ilaha illallah. La ilaha illallah. La ilaha illallah. How's everybody doing? Okay, so we're going to do the last song, song number 8. This is a confession. Okay, I just made up this song for the valley, and I'm a little nervous about it, but we'll do it. We'll make it happen. So if you feel like joining in, whenever you feel it. So we're going to go like high on the first 2 lines and then lower on the second 2 lines. To the sun that's with the rain, let's the earth awaken again. We are the fire, we are the sea, we are the change the world needs. Sing to the sun dance with the rain, bless the earth awaken again. We are the stone, we are the stream, strong yet flowing, led by dreams. Sing to the sun, dance with the rain, bless the earth awaken again. We are the stars, we are the night, wisdom and wonder shining bright. Sing to the sun, dance with the rain, bless the earth awaken again. We are the roots, we are the sky, growing below, rising high. Sing to the sun, dance with the rain, bless the earth awaken again. We are the voice, we are the sound, calling the sacred circling round. Sing to the sun, dance with the rain, bless the earth awaken again. Hand in hand, hearts open wide, one valley, one people side by side. One valley, one people side by side. One valley, one people side by side. All right, what do you think?
That's awesome.
Let's try it again. Sing to the sun, dance with the rain, bless the earth awaken again. We are the fire, we are the sea, we are the change the world needs. Sing to the sun, dance with the rain, bless the earth awaken again. We are the stone, we are the stream, strong yet flowing, led by dreams. Sing to the sun, dance with the rain, bless
We are the stars, we are the night, wisdom and wonder shining bright. Sing to the sun, dance with the rain, bless the young, awaken again. We are the roots, we are the sky, growing below, rising high. Sing to the sun, dance with the rain, bless the young, awaken again. We are the voice, we are the sound, calling the sacred circling round. Sing to the sun, dance with the rain, bless the young, awaken again. Hand in hand, hearts open wide, one valley, one people side by side. One valley, one people side by side. One valley, one people side by side.
Oh.
I just feel like we're all enjoying this amazing valley together, right? We all see the sun and feel the sun and the water and just like we're so fortunate to be here. So I guess that's it. So we're closing this circle. I was thinking maybe we could circle up and just hold hands and do 3 ohms together because that feels so good to do that. Let's do that. Thank you.